students, now we are going to see important question from pharmaceutics. So let's get started with the very first question. The first question is, drugs with saturation or capacity limited metabolism exhibit. Now first of all, what do you mean by linear pharmacokinetics and what do you mean by non-linear pharmacokinetics? So linear pharmacokinetics means the plasma drug concentration is directly proportional to the amount of the dose, right? So that becomes the linear. Non-linear happens when whatever the enzymes are there that have been saturated and now the drug is not binding effectively to that enzymes, and that is the reason you observe the non-linear pharmacokinetics. You observe the non-linear pharmacokinetics. So the options were linear pharmacokinetics, non-linear, no pharmacological action, no pharmacokinetics. So basically non-linear pharmacokinetic is the right answer. Next question is absorption rate constant, which is given by Ka. It is determined by plotting percent of drug and absorbed versus time. The method is known as Henderson-Hasselbalch, Wagner-Nelson method, method of residuals, 𝘂𝙃 method. So we know that Henderson-Hasselbalch equation is related to the pH and the pK value of the drug. It tells about the ionization of the drug. Whereas the absorption rate constant, it is given by Wagner-Nelson method. Option B is the right answer. Next is from the dosage form, that is dentifrice. It is included in cold cream, vanishing cream, tooth powder, toothpaste or hair creams. Dentifrices, it is for the tooth powder, toothpaste to clean the oral cavity. Option C is the right answer. Next is about the calculate the mean residence time of a drug when AUC is 43 microgram per ml per hour and AUNC is, that is area under movement curve, okay? So that is 1870 microgram per ml per hour square. Now remember that the units are same, so you don't have to convert it into any kind of unit. But remember, if units are different at that time, you have to make sure that units are same. Now the formula for MRT, mean residence time, is equal to AUMC, that is area under movement curve, divided by area under curve. So here it is 1870 divided by 43. Approximately you will get 43.48 hours. Okay. The units you can see that microgram, hour and ml will go. This one will go and it is HR, that is hour. Okay. So mean residence time, it is given into hour. So option A is the right answer. Next is catgut. It is used as absorbable suturing material, non-absorbable suturing material, a synthetic suturing material or the dressing material. Remember catgut, it is the absorbable suturing material. It is used as the absorbable suturing material. Next is ophthalmic solutions need to be ophthalmic solutions are the one which is instilled into the eyes. Ophthalmic solutions are something which is instilled into the eyes. Option A is hypertonic, option B is hypotonic, option C is both sterile and isotonic, need not to be sterile. Now remember, if you are instilling anything into the eyes, first of all it has to be isotonic. That means it should have same osmotic pressure with that of the tear fluid. So we are considering that it is having the same tonicity with the tear fluid. Next thing is that if it is not sterile, it can lead to certain kind of microorganism contamination and it will give the infection to the eyes. So it has to be sterile also. Next, one more thing is pyrogen free, which is the case for the intravenous or basically systemic circulation. But ophthalmic solution, even if it is not pyrogen free, that is also fine because pyrogen cannot cross the membrane and enter into the blood circulation from the eyes. So pyrogen free, sterile, isotonic, these are there for the parenteral preparation. But for ophthalmic, isotonicity and the sterility is important. Hypertonic, which is having, hyper means your formulation is having higher tonicity as compared to the tear fluid. Hypotonic means your formulation is having lesser tonicity as compared to the tear fluid, which should not happen, and that is the reason it should be isotonic and also it should be sterile. So it should be both sterile and isotonic. Option C is the right answer. The next question is hair conditioner. It is used for cleaning of hair, coloring of hair, smoothing and to detangle the hair for combing or shaving purpose. For cleaning of hair, we are using shampoos which contains primary and secondary surfactant. Coloring of hair, we are using hair colors. So conditioner is for the smoothing and to detangle the hair for the combing purpose. Shaving purpose, we are not using hair conditioner. Shaving creams are there. Option C is the right answer. The next question is identify the one which is not suitable as propellant in aerosol. Compressed CO2, chlorofluorocarbon, that is 11 or 12, hydrocarbon or water vapor. So propellant we are using in the aerosol, that is the pressurized dosage form. So all the gases compressed CO2 because they have the tendency to undergo a pressurized dosage form. Water vapor is something we are not using as a propellant in the aerosol, so that is not suitable for the aerosol. Next is identify the largest size. So the next question is identify the largest size for the hard gelatin capsule. Okay. So hard gelatin capsule, it is a 2-piece capsule. So the sizes are like 000, which is the largest, followed by 000, 1, 2, 3, 4, 5. 5 being the smallest in terms of the volume. So 000 is the largest. Option A is the right answer. Next question is identify. If we talk about before that, if we talk about how much quantity it can accumulate, so approximately 950 mg, it can accommodate into the hard gelatin capsule, which is having the 000 size. Okay. Next question is identify the super disintegrant agent used in the tablet making. Super disintegrant means which will facilitate the breakup of the tablet when it comes in contact with the gastrointestinal fluid. Option A is starch. Option B is sodium carboxymethyl cellulose. Option C is sodium starch glycolate. Option C is sodium lauryl sulfate. Remember, starch is either it can be used as a diluent, or if you are using as a starch paste, you can use it as a binder. Next is sodium CMC. CMC, it is like a you are using it as a sodium carboxymethyl cellulose, maybe as a diluent because it is a cellulose derivative. Sodium starch glycolate is the right answer. Sodium lauryl sulfate, it is a surfactant. It is used when your drug is not having good water solubility. So super disintegrate sodium starch glycolate, that is your option. C is the right answer. Next is identify the flocculating agent which has the maximum capacity. Now flocculating agent is nothing but, say for example, these are your drug particles and you are adding it into the suspension which will hold that, okay, suspension which will hold that, and it will form the loose aggregate. So for that reason we are adding certain kind of ions. These ions are monovalent. This is a Shulhardy rule. Divalent or trivalent. If it is a monovalent, it can accommodate only one solid particle or the drug particle. Divalent 2, trivalent 3. So 3 is having higher efficiency, right? So your maximum capacity now that depends upon the valency of the valency of that ions. Now in the Na it is having +1, MgCl2 that is +2, magnesium is having +2, aluminium is having +3, calcium is having 2. So if you see option C is the right answer. Creaming and caking are noticed respectively respectively in. Okay. So these are the phenomena which is observed where. Okay. Nano emulsions and nano suspension. Do we see creaming in nano emulsions and nano suspensions in which the particle size is already less? We do not observe this kind of phenomena. Option B is suspensions and emulsion. Respectively, we have to see. That means creaming occurs in suspension? No. Creaming occurs in the emulsion and caking occurs in the suspension. Option B is not there. Option C emulsions and suspension. So that is the right answer. Emulsion and suspension. Option D nano suspension, nano emulsion. No. Option C is the right answer. That is emulsion and suspension respectively. Next is Oswald ripening is a problem noticed during the storage of suspension with variable sized particles, suspension with uniform mono-sized particles, dried nano suspension, or dry syrup for reconstitution. So, Oswald ripening means when your suspension is not uniform. Say these are the smaller particles, then larger particles. What happens is these smaller particles deposit on the larger particle and it forms the crystal. So this phenomenon is known as Oswald ripening. When it will happen? When the suspension is present in the different sizes, particle sizes. Option A is the right answer. Next is identify the study not relevant to the pre-formulation, which is not relevant to the pre-formulation. Drug excipient compatibility, assay of drug in formulation, solubility of the drug, solution stability. Now remember, pre-formulation means the studies which are conducted before the formulation. That means only for the drug. You check the study like XRD will be there, polymorphism, crystalline, amorphous, stability. Then we have solubility also. So drug excipient compatibility, yes. We take the drug, mix with different excipient and subject it to various temperatures. We are doing that. Assay of drug in formulation, no. That happens after formulating the drug into a suitable dosage form. So option B is not the correct study to be done in the pre-formulation, but that is the right answer. Option B is the correct one. Next is identify monomolecular inclusion complex from the following. Retinoic acid and beta-cyclodextrin, hydroquinone and methyl alcohol, starch iodine, montomorillobite and alcohol complex. So monomolecular inclusion complex, that is your retinoic acid and beta-cyclodextrin. Remember, beta-cyclodextrin is also hydrophilic in nature. So sometimes if the drug is not soluble, we try to incorporate into this beta-cyclodextrin, which will also increase the water solubility. Next is viscosity. Identify the rotational viscometers from the following pairs. Before the option 1, 2, 3, 4 are given. First is Pauling sphere viscometer. So that does not come under the rotational. Cup and bob, yes. Capillary is not there, and cone and head. So basically 2 and 4. That means option D is the right answer. These are the different examples of the viscometer. Next is zeta potential. Next is about the zeta potential. What is zeta potential? The potential difference between solid surface and electrically neutral region. Electrical neutral region is correct, but it is not about the solid surface. What it is, we will see. The potential difference between solid surface and shear plane. Shear plane is the right answer, but not between the solid surface. Option B is not there. Option C is shear plane and electrically neutral region, yes. So option C is the right answer. D is potential difference between 2 points in the column of a liquid. Option C is the right answer. So zeta potential should be either negative, that is, it should not be within the plus minus 20 to 30 millivolt. Next is HLB value of twin 20. Now remember, twin is hydrophilic in nature. And the hydrophilic surfactants are having HLB of more than 10. So remember that it is according to Bancroft rule. If it is hydrophilic, it will form O by W type of emulsion. That means it becomes water becomes the external phase. For 2 in 20, 16.7 is the right answer. Identify the pair where no interface is possible. Gas, gas, solid, solid, liquid, liquid, or gas, liquid. Solid, solid. See, if there is no interface, that means at least one of the surface should be visible. So solid, solid, there is an interface. Liquid, liquid, there is an interface. Gas, liquid, at least the surface of liquid is interface. But in gas, gas, there is no interface. Here, so many environments, so many gases are present. So you cannot identify them. So there is no interface possible. Option A is the right answer. Next is the shear thinning system fall under the category of shear thinning and shear thickening. Whenever you apply shear stress, whenever you apply the force, the molecule has the tendency to undergo lesser viscosity. Okay, and shear thickening means which will increase in the volume. Because the volume is been increased, we call it as dilated. So dilated is not there because that is the shear thickening system. Here they are asking about the shear thinning system. Newtonian, that comes basically shear thinning comes under your non-Newtonian fluid, right? So the flow of fluid is categorized as Newtonian fluid where the rate of shear and the shearing stress is directly proportional. Then you have non-Newtonian which is having dilated or shear thinning, plastic, pseudoplastic. Okay. Newtonian is not there because that is not the shear thinning system. Shear thinning is not possible, it is possible. Okay. Basically, it is the category of the thixotropic substances. Option C is the right answer. Next is identify the polymorphs of the theobroma oil required in the suppository. Theobroma is nothing but your coca butter. Theobroma is nothing but the coca butter. Now, the ideal characteristic to be there for the coca butter or any kind of suppository base is that it should be solid at room temperature. At the same time, it should melt at body temperature, right? The only form is beta form because that is having the melting point near to the body temperature. So at room temperature it is solid and at body temperature it will melt. So beta form is the stable form. Option C is the right answer. Next is liquid crystalline state exhibited by certain material is known as gaseous state, liquid state, solid state, or mesophase. So liquid crystalline, so that is not the gas, liquid or solid. If it is only crystalline, then we can say that it is a solid, but it is a meso state, that means in between the solid and the liquid. Next is GCP deals with obtaining of the data in human clinical studies, non-clinical studies, preclinical, good clinical practices. So basically, GCP is the good clinical practices, not cleaning, okay? And cleaning indicates that the human trials, something which is done in the human. Preclinical means before the human trials, that means the animal study. So GCP deals with the human clinical studies. Next is heroin is controlled under this law. It is a narcotic substance, you all know that. Pharmacy Act 1948, they do not do anything with the narcotic and the psychotropic substances. Drug and Cosmetic Act 1940 and rules 1945, no. Narcotic drugs and psychotropic substances, yes. Whatever the related to the import, export, everything related to the narcotic and the psychotropic substances, that has to be done under the Narcotic Drugs and Psychotropic Substance Act 1985. And it is not related to the Medicinal and Toilet Preparation Act as well. Option C is the right answer. Next is for a registered pharmacist, education regulations are covered under Pharmacy Act 1948 and its amendment, Drug and Cosmetic Act, Drug Price Control Order, or UGC Act 1955. We know that for registered pharmacists, the Pharmacy Act is there, 1948, and its amendments. Next is continuous product quality is ensured in the industry by. So there is one department, that is a quality assurance department. They make sure that whatever product is there, that is having that particular quality, whatever formulation you are preparing, this department is there to monitor all these things. That is the quality assurance, QA department is there. Next is manufacture, storage and supply of vaccines are regulated by the provision of Pharmacy Act, Drug and Cosmetic Act, Narcotic Drugs and Psychotropic Substances, and Drug Price Control Order. We know that vaccines and everything that comes under your Drug and Cosmetic Act 1940. Pharmacy is about the education related thing. Narcotic vaccine does not comes under the narcotic substances. Drug Price Control Order, that is related to the pricing authority. Okay, option B is the right answer. That was all the questions from the pharmaceutics, and we will see you all in the next upcoming pharmaceutics subjects. Till then, thank you so much and all the very best for your preparation.
Hello aspirants, GDC English classes కు మీకు స్వాగతం సుస్వాగతం. సో ఈ వీడియోలో మనం తెలంగాణ పీజీ సెట్ సంబంధించి ఫార్మకాలజీ సబ్జెక్ట్ నుంచి MCQs విత్ ఆన్సర్స్ మనమైతే డిస్కస్ చేద్దాము. సో మీ ప్రిపరేషన్ అయితే చాలా బాగా జరుగుతుందని ఫీల్ అవుతున్నాను. సో అదే విధంగా కంటిన్యూ చేయండి. ఎందుకంటే నాకు తెలిసినంత వరకు GPAT నైపర్ మిస్ అయిన తర్వాతే అటు ఛాన్స్ లేదనుకుని మీరు ఇటు వచ్చి ఉంటారు. సో అసలు ఏం వరీ అవ్వద్దు, ఎప్పుడు కూడా మీ స్టాండర్డ్స్ హైగానే పెట్టుకోండి. GPAT నైపర్ అనేది జస్ట్ ఒక చిన్న స్టెప్ మాత్రమే లైఫ్ లో. సో అది లేకుండా కూడా చాలా మంది కూడా హైయర్ పొజిషన్స్ రీచ్ అయ్యారు. అల్టిమేట్ గా మీ విల్లింగ్నెస్, మీ ఫోకస్నెస్, మీ డిసిప్లిన్ కనుక ప్రాపర్ గా ఉంటే మీరు త్రూ ఏ దారిలో అయినా సరే ఫార్మా ఫీల్డ్ లో మీరు టాప్ లెవెల్కి మీరు వెళ్ళగలరు. అండ్ నేను మీకు చాలాసార్లు చెప్పే ఉన్నాను, ఈ వీడియోస్ లో కావచ్చు, ఆ రెగ్యులర్ GDC క్లాస్ వీడియోస్ లో కావచ్చు, మీరు చదువుతుంది ఓన్లీ పీజీ సెట్ కే కాదు, రాబోయే ఫార్మసిస్టు, తెలంగాణ డ్రగ్ ఇన్స్పెక్టర్ కావచ్చు, నేషనల్ లెవెల్ UPSC డ్రగ్ ఇన్స్పెక్టర్ కావచ్చు, వాటికి మీరు చదువుతున్నారు మర్చిపోవద్దు. అల్లాటప్పగా తీసుకుంటే కనుక మన లైఫ్ కూడా అట్లా ఉంటుంది. సో సీరియస్ గా ఉండండి. ఒక్క 1 year కనుక మీరు ఫోకస్ చేయగలిగితే డెఫినెట్ గా మీ అప్కమింగ్ రాబోయే 30 years ఆఫ్ ప్రొఫెషనల్ కెరీర్ యాజ్ వెల్ ఫైనాన్షియల్ కెరీర్ అనేది చాలా స్ట్రాంగ్ గా ఉంటుంది. సో కాన్ఫిడెంట్ గా ఉండండి. సో కాన్ఫిడెంట్ గా ఉన్నప్పుడు మన డెసిషన్ మేకింగ్ కూడా చాలా బాగుంటుంది. సో ఎనీవే, సో గోయింగ్ ఇన్ టు ద డీటెయిల్స్. అండ్ మీకు తెలుసు GDC క్లాసెస్ అనేది ఎస్పెషల్లీ సౌత్ రీజన్ లో తెలంగాణ, ఆంధ్ర, కర్ణాటక, తమిళనాడు, కేరళ ఈ రీజన్ లో ఉన్న స్టూడెంట్స్ కి హిందీ అనేది అంత ప్రాపర్ గా ఉండదని చెప్పేసి ఇంగ్లీష్ లో లాస్ట్ 3 years నుంచి మేము క్లాసులు కండక్ట్ చేయడం జరుగుతుంది. ఐఎమ్ ది ఇనిషియేటర్, మైసెల్ఫ్ అశోక్ కుమార్, GDC సౌత్ కోఆర్డినేటర్. GPAT కావచ్చు, నైపర్ కావచ్చు, డ్రగ్ ఇన్స్పెక్టర్ కావచ్చు, ఫార్మసిస్ట్ కావచ్చు, అన్ని కోచింగ్ అయితే ఇక్కడ అవైలబుల్ అవుతున్నాయి. అండ్ ఫార్చునేట్లీ రాబోయే రోజుల్లో మీ యొక్క రెస్పాన్స్ బట్టి, మీ యొక్క డిమాండ్ బట్టి తెలుగులో కూడా పూర్తిగా క్లాసులు అయితే కండక్ట్ చేయబోతున్నాం అనమాట. నెక్స్ట్, సో ఇక్కడ మన MCQs పరంగా చూసుకుంటే కనుక, వాట్ ఇస్ ద ఫస్ట్ MCQ? Which of the following is an antiprotozoal agent? So name itself indicating the drugs helps in the treatment of protozoal infections like amoebiasis. So amoebiasis is caused by Entamoeba histolytica. Entamoeba, the amoeba enter into the intestine and causes lysis of tissue, GIT. Entamoeba histolytica. So example like amytine, caffeine, psilocybin, vaccicine. So vaccicine nothing but from the Vasaka, a bronchodilator. Psilocybin is also one of the alkaloid. Caffeine, a CNS stimulant, and amytine. Amytine, name itself indicating it causes emesis, as well as it is also one of the drug, a natural alkaloid in treatment of protozoal infections, especially amoebiasis, that is Entamoeba histolytica. Causing organism is Entamoeba histolytica. So answer is very simple, amytine. Amytine is the answer, but amytine is not preferred. ఎమిటిన్ ని ఎక్కువగా యూజ్ చేయరండి, ఎందుకంటే కనుక దీనివల్ల సైడ్ ఎఫెక్ట్స్ ఉంటాయి అన్నమాట. అందుకని ఒకవేళ మిగతా డ్రగ్స్ పనిచేయకపోతే అప్పుడు దీని జోలు వస్తారు. సో నెక్స్ట్ MCQ. సో బయో అవైలబిలిటీ ఈజ్ మెజర్డ్ యాజ్. సో బయో అవైలబిలిటీ, the amount of concentration of drug present in the blood after absorption. The amount of concentration of drug present in the blood after absorption. Nothing but bioavailability. How much drug available in the blood after absorption is bioavailability. So it is measured as a AUC, Tmax, Cmax, T half-life. I hope దీనికి ఆన్సర్ మీకు తెలుసు. AUC, area under the curve. AUC nothing but area under the curve. Next, acetazolamide is an loop diuretic, high ceiling diuretic, potassium sparing diuretic, carbonic anodase inhibitor. So loop diuretics are also known as high ceiling diuretics. And the loop diuretics example is furosemide. And potassium sparing diuretics nothing but ఇక్కడ మీరు గమనిస్తే కనుక డైరెటిక్స్ లో థైజైడ్ డైరెటిక్స్, లూప్ డైరెటిక్స్ కామన్ గా వాడతారండి. కానీ థైజైడ్ డైరెటిక్స్, లూప్ డైరెటిక్స్ కామన్ ప్రాబ్లం ఏంటి? హైపోకెలీమియా. దే డిక్రీజ్ పొటాషియం లెవెల్స్ ఇన్ ద బ్లడ్. సో పొటాషియం లెవెల్స్ బాగా తగ్గిపోతే బ్లడ్ లో కార్డియక్ అరిథ్మియాస్, మజిల్ ట్విచ్చింగ్స్, మజిల్ వీక్నెస్ ప్రాబ్లం వస్తుందండి. అందుకని ఏం చేశారు, పొటాషియం స్పేరింగ్ డైరెటిక్స్ తీసుకొచ్చారు. పొటాషియం స్పేరింగ్ డైరెటిక్స్ ఏం చేస్తాయి, పొటాషియం లోపల నుంచి సోడియం బయటకు పంపిస్తాయి. సోడియంతో పాటు వాటర్ బయటకు వెళ్ళిపోతుంది, లోపల ఉన్న ఫ్లూయిడ్ వాల్యూమ్ కూడా తగ్గిపోతుంది. సో పొటాషియం sparing derivatives like spironolactone. Carbonic anhydrase inhibitor, they inhibit the carbonic anhydrase enzyme like 𝘎𝑗 𝑑𝑜𝑠𝑗. These are carbonic anhydrase inhibitors. Answer is very clear. Option D is the answer. And moving to the next MCQ. What is the next MCQ here? Which of the following opium related anti-tussive drug has very low addictive properties? సో ఇచ్చిన డ్రగ్స్ లో అన్ని కూడా ఓపియాయిడ్ డెరివేటివ్స్, మేజర్ ఆల్కలైడ్స్ కావచ్చు, మైనర్ ఆల్కలైడ్ కావచ్చు. కాకపోతే వీటిల్లో ఒకదానికి చాలా తక్కువ అడిక్షన్ ప్రాపర్టీ ఉంటుంది అనమాట. సో ఓపియాయిడ్స్ అనే డ్రగ్స్ ఏంటంటే మనకి సిఎన్ఎస్ మీద యాక్షన్ చూపిస్తాయి. సో సిఎన్ఎస్ మీద యాక్షన్ చూపించడం వల్ల ఏమవుతుందంటే కనుక అడిక్షన్ ఇస్ ద కామన్ ప్రాబ్లమ్. సో ఎగ్జాంపుల్ లైక్ నాస్కపిన్, హెరాయిన్, కోడైన్, డెక్స్ట్రోమెథార్ఫోన్. So heroin, 𝘎𝙬𝙎𝑃ℎ, highly lipophilic, high risk of addiction. Codeine, yes, codeine is an antitussive, it is having little risk of addiction. And dextromethorphan also one of the opioid derivative. And among this, one of the alkaloid, a minor alkaloid having less chance of addiction is the naskapin. అండ్ ఆల్రెడీ నా క్లాస్లో మీకు చెప్తూనే ఉంటాను, మీ చదివే విధానం అనేది ఎప్పుడూ కూడా మీరు రాబోయే 2 to 3 months లో ఉన్న ఎగ్జామ్స్ మీరు చదువుతున్నట్టయితే మీ ప్రిపరేషన్ అనేది నెక్స్ట్ 1 year కి రాబోయే ఎగ్జామ్స్ కూడా దాని తగ్గట్టుగా ఉండాలి. అండ్ ఇప్పుడు ఫార్మకాలజీ, ఫార్మకోగ్నసీ, మెడిసిన్ కెమిస్ట్రీ మీరు కాంబినేషన్ చదివితే ఏమవుతుందంటే కనుక సో మీకు వేరియస్ అమౌంట్ ఆఫ్ క్వశ్చన్స్, ఆన్సర్స్ అర్థం చేసుకునే ఛాన్స్ ఉంటుంది. అండ్ బల్క్ అమౌంట్ ఆఫ్ ఇన్ఫర్మేషన్ మీరు ఈజీగా గుర్తుపెట్టుకోవచ్చు. ఇప్పుడు ఎట్రోపిన్ కి ఫార్మకాలజీ చదవచ్చు, ఫార్మకాగ్నసీ చదవచ్చు, మెడిసిన్ కెమిస్ట్రీ కూడా మీరు చదవచ్చు. అట్లా అనమాట. అంటే మీ అప్రోచ్ అనేది చాలా బాగుండాలండి. నెక్స్ట్, చూస్ ద రైట్ పేర్ విత్ రిగార్డ్ టు బయోఎస్ఏ మెథడ్స్. అంటే ఇక్కడ బయోఎస్ఏ మెథడ్స్ పరంగా చూసుకుంటే కనుక సో డ్రగ్ దాని మెథడ్ ఇచ్చారు, ఇందులో కరెక్ట్ ఏంటనేది చూడమని చెప్తున్నాడు. సో ఆక్సిటోసిన్, మ్యాచింగ్ మెథడ్ యూజింగ్ గునియాపిగిలియం, హిస్టమైన్, ఇంటర్పోలేషన్ యూజింగ్ rat uterine horn, ఇన్సులిన్, బ్రాకెటింగ్ మెథడ్ using rat to blood pressure, serotonin, 3-point bioassay using rat to fundus strip. సో ఇక్కడ సో డ్రగ్స్ వాటి యొక్క బయోఎస్ఏ మెథడ్స్, ఏ మెథడ్ ద్వారా వీటిని బయోఎస్ఏ చేస్తారని ఇచ్చారనమాట. ఆన్సర్ ఇస్ వెరీ క్లియర్. సెరటోనిన్ అనేది 3-point బయోఎస్ఏ యూజ్ చేసి rat to fundus strip ని వాడతారనమాట. అండ్ దిస్ ఇస్ ద రైట్ పేర్ అమాంగ్ దిస్ ఆల్ 4 ఆప్షన్స్. ఓకే, next question. Regarding the next question, which of the following selective estrogen receptor modulator is useful to treat infertility? So infertility, the person or nothing but women or men unable to fertile, lack of fertilization, and in that condition one of the SERM useful, selective estrogen receptor modulator. అంటే ఏంటంటే కనుక ఈస్ట్రోజన్ రిసెప్టార్స్ యొక్క కౌంట్ ని పెంచవచ్చు, తగ్గించవచ్చు. మాడ్యులేటర్ బేస్డ్ ఆన్ కండిషన్ బేస్ చేసుకొని they can increase the receptor count or decrease the receptor count. So clomiphene citrate, tamoxifen, raloxifene, torephin. సో జనరల్ గా మనం చూసుకుంటే కనుక ఈవెన్ క్లోమిఫిన్ సిట్రేట్ అనేది ఐవీఎఫ్ లో కామన్ గా యూజ్ చేసే డ్రగ్ అండి, ఇన్ విట్రో ఫర్టిలైజేషన్. సో క్లోమిఫిన్ సిట్రేట్ is a selective estrogen receptor modulator, common drug in vitro fertilization. The answer is very clear. Clomiphene citrate, a selective estrogen receptor modulator used in vitro fertilization. Next, all beta blockers are effective in elevating the symptoms of hyperthyroidism, but only one of the following beta blocker is effective in inhibiting peripheral conversion of T4 to T3. So T4 is an inactive thyroid hormone, T3 is an active thyroid hormone that binds to the thyroid receptors and shows thyroid hormone function. And ఇక్కడ థైరాయిడ్ హార్మోన్స్ మనం చూసుకుంటే కనుక దే బైండ్ టు ద న్యూక్లియర్ రిసెప్టార్స్ అండి. సో న్యూక్లియర్ రిసెప్టార్స్ కి మనకి స్టెరాయిడ్స్ లైక్ గ్లూకోకార్టికాయిడ్స్ బైండ్ అవుతాయి. అలాగే PPR, పెరాక్సిమల్ ప్రొలిఫరేటివ్ యాక్టివిటీ రిసెప్టార్స్ న్యూక్లియర్ రిసెప్టార్స్ కిందకి వస్తాయి. అలాగే విటమిన్ A and D, అలాగే థైరాయిడ్ హార్మోన్స్ న్యూక్లియర్ రిసెప్టార్స్ కి బైండ్ అవుతాయి అన్నమాట, వాటికి యాక్షన్ చూపించడం కోసం. అయితే ఇక్కడ అడుగుతున్న క్వశ్చన్ ఏంటి, ఇక్కడ ఇచ్చిన బీటా బ్లాకర్స్ అన్ని కూడా జనరల్ గా థైరాయిడ్ సిమ్టమ్స్ ని పెంచే ఛాన్స్ ఉంటుంది, హైపర్ థైరాయిడిజం సిమ్టమ్స్ ని పెంచే ఛాన్స్ ఉంటుంది. కానీ వన్ ఆఫ్ ద బీటా బ్లాకర్ దట్ ప్రివెంట్ ద కన్వర్షన్ ఆఫ్ ఇన్యాక్టివ్ థైరాయిడ్ హార్మోన్ టు యాక్టివ్ థైరాయిడ్ హార్మోన్. సో జనరల్గా టిమోలాల్ చూసుకుంటే కనుక గ్లాకోమాలో వాడతారు. ప్రొప్రానోలాల్ ఏ నాన్ సెలెక్టివ్ బీటా బ్లాకర్, do not take in asthma patient. Atenolol a selective beta blocker. Metoprolol is also a selective beta blocker. But here propranolol will be the answer. Propranolol will be the answer. So what this propranolol will be do? Propranolol అనేది ఈ T4 నుంచి T3 ని కన్వర్ట్ అవ్వకుండా చేస్తుంది, తద్వారా హైపర్ థైరాయిడిజం తగ్గిస్తుంది. అలాగే హైపర్ థైరాయిడిజం లో మనకి ఏంటంటే కనుక హైపర్ థైరాయిడిజం లో సింపాథిక్ నర్వస్ సిస్టమ్ యాక్టివ్ ఎక్కువ ఉంటుందండి. సో ప్రొప్రానోల్ ఇస్తే ఏమవుతుంది, T4 నుంచి T3 గానే మారట్లేదు, అలాగే సింపాథటిక్ నర్వస్ సిస్టమ్ యొక్క యాక్టివిటీని కూడా తగ్గించి టాకీకార్డియా కాకుండా హార్ట్ బీట్ ని కంట్రోల్ చేస్తుంది. ఆన్సర్ ఇస్ వెరీ సింపుల్, ప్రొప్రానోలాల్. నెక్స్ట్, the following used as a oral anticoagulant. So like enoxaparin, heparin, lepidolin as well as warfarin. So what is your answer? So like enoxaparin, heparin, lepidolin, warfarin, all are anticoagulants. They used to treat, they used to prevent clot formation. Especially these drugs acts on the clotting factors, directly acts on the clotting factor. So enoxaparin, heparin, lepidolin, all the parental anticoagulant. Warfarin is a oral anticoagulant. Heparin is naturally present in the body, and this heparin overdose can be treated by protamine sulfate. Protamine sulfate is an antidote for heparin sulfate. Okay. So antidote poisoning antidote is table ఉంటుందండి, అది చాలా చాలా ఇంపార్టెంట్, మిస్ అవ్వకుండా చూసుకోండి. Next question. Answer is very simple. Warfarin is an oral anticoagulant and remaining all are parenteral, because heparin, because of large molecule weight, ionic nature, it not suitable to the oral route. No good absorption through oral route. That's why heparin has a parenteral, and warfarin because of small molecule weight, good absorption it is taken by the oral route of administration. Next question. The cytotoxic agent acting as a S-phase specific DNA synthesis inhibitor. So మీ ఆన్సర్ ఏంటి చూడండి. సో cyclophosphamide, hydroxyurea, bleomycin, docetaxel, all these are anti-cancer drugs. But ఈ anti-cancer drugs, yes, they are cytotoxic, they kill the cancer cells, they act on S phase of the cancer cells and specifically inhibiting DNA synthesis in the cancer cells. జనరల్ గా క్యాన్సర్ సెల్ అయినా హ్యూమన్ సెల్ అయినా సరే అందులో మనకి M phase, S phase, G phase ఇలా ఉంటాయి అన్నమాట. సో ఎస్ ఫేజ్ ఆఫ్ సెల్ డివిజన్ లో డిఎన్ఏ సింథసిస్ జరుగుతుంది. ఇక్కడ మన యాంటీ క్యాన్సర్ డ్రగ్స్ మోస్ట్లీ దే యాక్ట్స్ ఆన్ ద ఎస్ ఫేజ్ ఆఫ్ ద క్యాన్సర్ సెల్ అండ్ ఇన్హిబిట్ ద డిఎన్ఏ సింథసిస్. సో ఈ లిస్ట్ ఆఫ్ డ్రగ్స్ లో ఆ డ్రగ్ ఏంటనే అడుగుతున్నాను అనమాట. సైక్లోఫాస్ఫమైడ్ ఏ ఆల్కలైటింగ్ ఏజెంట్, బ్లియోమైసిన్ ఏ యాంటీబయాటిక్ ఫ్రమ్ ద యాంటీ క్యాన్సర్ కేటగిరీ, డోసెటాక్సెల్ a semi-synthetic derivatives from the taxanes, plant derivative as a anti-cancer drug. So here one of the drug like hydroxyurea. So just addition of a OH to the urea, hydroxyurea. This hydroxyurea having anti-cancer activity, especially the anti-cancer activity because of it inhibiting DNA synthesis in S phase of the cancer cell cycle. S phase of the cancer cell cycle. Okay. అండ్ మీకు తెలుసు సైక్లోఫాస్ఫమైడ్ అనేది కామన్ గా డ్రాబ్యాక్ కాజ్ చేస్తుంది హెమరైజిక్ సిస్టైటిస్ అనే కామన్ డ్రాబ్యాక్ కాజ్ చేస్తుంది. దానిలో మెస్నా యూజ్ చేస్తారండి, మర్క్యాప్టో ఈథెన్ సల్ఫోనేట్, 2 మర్క్యాప్టో ఈథెన్ సల్ఫోనేట్, దట్ ఈస్ మెస్నా. నెక్స్ట్ క్వశ్చన్ చూద్దాం. సో ఏమి ఇచ్చారు నెక్స్ట్ క్వశ్చన్ ఇక్కడ, choose the correct statement with regard to the glitazones, thiazolidinediones, a oral hypoglycemics. So glitazones like troglitazone, pioglitazone, sioglitazone, rosiglitazone, these are glitazones chemically known as thiazolidinediones comes under hypoglycemics, oral anti-diabetics, helps in treatment of type 2 diabetes. అయితే ఇక్కడ ఏం చెప్తున్నారంటే కనుక ఈ థైజోలిడిన్ లేదా గ్లిటజోన్స్ గురించి ఒక రైట్ పాయింట్ సెలెక్ట్ చేసుకోండి, చూస్ ద కరెక్ట్ పాయింట్. సో చూడండి ఒకసారి, దే యాక్ట్ బై ఇన్హిబిటింగ్ ద ఆల్ఫా గ్లూకోసిడేస్ ఎంజైమ్, దే కాజ్ ఇంక్రీజ్ ఇన్ ఇన్సులిన్ రెసిస్టెన్స్, దే కాజ్ వెయిట్ గెయిన్ బై ఇంక్రీజింగ్ సబ్క్యూటేనియస్ ఫ్యాట్ ఆర్ ఫ్లూయిడ్ రిటెన్షన్, ఇట్ కాజెస్ సివియర్ లాక్టిక్ యాసిడోసిస్. సో ఫస్ట్ చూసుకుంటే కనుక దే యాక్ట్ బై ఇన్హిబిటింగ్ ఆల్ఫా గ్లూకోసిడేస్, నో, ఆల్ఫా గ్లూకోసిడేస్ ఎంజైమ్ ఇన్హిబిటింగ్ బై ద మిగ్లిటాల్, అకార్బోస్, they are also hypoglycemics. They cause increase in insulin resistance. No, ఈ డ్రగ్స్ ఇన్సులిన్ రెసిస్టెన్స్ ని తగ్గించి ఇన్సులిన్ యొక్క పనితీరును పెంచి బ్లడ్ లో ఉన్న గ్లూకోజ్ ని తగ్గించేలా చేస్తాయి అన్నమాట. సో కాదు. అండ్ దే కాజ్ weight gain by increasing subcutaneous fat or fluid retention. ఎస్, వెరీ గుడ్, ద ఆప్షన్ సి ఇస్ ద కరెక్ట్. ఎందుకంటే గ్లిటజోన్స్ అనే డ్రగ్స్ ఏంటంటే కనుక డ్యూ టు డిస్టర్బింగ్ అవర్ హోమియోస్టాసిస్ అవి మన బాడీలో ఫ్లూయిడ్ రిటెన్షన్ ని కాజ్ చేసి ఫ్యాట్ అక్యుములేషన్ ని పెంచి వెయిట్ గెయిన్ ని ప్రమోట్ చేస్తాయండి. దట్ ఈస్ అ మేజర్ డ్రాబ్యాక్ విత్ థైజోలిడిన్ డయోన్స్, గ్లిటజోన్స్, అలాగే సల్ఫోనిల్ యూరియాస్. Sulfonylureas, thiazolidines are hypoglycemics. Both are having commonly weight gain as a drawback. That's why to neutralize that weight gain of sulfonylureas, these thiazolidines, metformin is combined. Metformin is a biguanide, one of the hypoglycemic, which may cause weight loss. I hope you know the thing. And it causes severe lactic acidosis. So lactic acidosis is a common drawback with the biguanides like metformin, fenformin. That's why fenformin, a biguanide oral hypoglycemic, withdrawn from the market due to severe lactic acidosis. So for this question, answer is the option C. Next question. So it is looking like easy question. So dash is a proton pump inhibitor. So H plus potassium ATPase. H plus potassium ATPase. So rabiprazole, ranitidine, sucralfate, simethicone. So what is your answer? The question is very easy. You already know the answer according to me. So S, simethicone, one of the drug used here in treatment of ulcers, and sucralfate, a ulcer protective agent, forms a sugar layer on the ulcer layer and prevent attack of HCl on the gastric walls. And ranitidine, a H2 blocker, and rabiprazole, lansoprazole, like these drugs are proton pump inhibitors, inhibit H plus potassium ATPase enzyme, decrease 80 to 90% HCl secretion. Decrease 90 to 80% HCl secretion. Very good. Keep going. So answer is option A, rabiprazole. Next. So here one of the question related to the our pharmacological experiments. So the gurinchi. Elevated plasmase and Morris water maze are used to evaluate antihypertensive activity, hypoglycemic activity, hepatoprotective activity, nootropic activity. Elevated plus అంటే మీకు తెలుసు మనం మేజ్ అని యూజ్ చేస్తాం. ప్లస్ మేజ్, జెడ్ మేజ్, వై మేజ్ అని చెప్పేసి. సో ఇది ప్లస్ మేజ్ అనుకున్నాం అనుకోండి, దీనిలో యానిమల్ ఆయిల్ పెట్టి అది ఎలా తిరుగుతుంది అనేది మనం అబ్జర్వ్ చేస్తాం. అంటే డ్రగ్ ఇచ్చినప్పుడు ఎలా బిహేవ్ చేస్తుంది, డ్రగ్ ఇవ్వనప్పుడు ఎలా బిహేవ్ చేస్తుంది. అంటే ఇక్కడ మేజర్ గా చూసుకుంటే కనుక ఈ ప్లస్ మేజ్ కావచ్చు, వై మేజ్ కావచ్చు, లేకపోతే వాటర్ మేజ్ టెస్ట్ కావచ్చు, ఇవేంటంటే కనుక యానిమల్ యొక్క మెమరీని తెలియచేయడానికి, యానిమల్ యొక్క మెమరీ ఎలా ఉందో తెలుసుకోవడానికి యూజ్ చేసే మోడల్స్ అనమాట. ఎలివేటెడ్ ప్లస్ మేజ్, మారిస్ వాటర్ మేజ్ ఆర్ యూజ్ టు ఎవాల్యుయేట్ యాంటీహైపర్టెన్సివ్స్, హైపోగ్లైసెమిక్స్, hepatoprotectives, nootropics. So nootropics nothing but memory enhancers. Nootropics nothing but also known as memory enhancer. They use it to enhance the memory in conditions like Alzheimer's disease. Alzheimer's disease is characterized by dementia, loss of memory. Okay, so the answer is option D is the answer. Nootropics like drugs helps in the treatment of Alzheimer's disease. They are known as nootropics. They use it to enhance the memory. They use it to అంటే మెమరీని కాపాడుతాయి అనమాట. ఆల్రెడీ మనం న్యూరాన్స్ డీజనరేట్ అయిపోతే చేసేదేం లేదు, మిగతా న్యూరాన్స్ డీజనరేట్ అవ్వకుండా తగ్గిపోకుండా చేసి ఉన్న మెమరీని కాపాడేలా చేస్తాయి అనమాట. నెక్స్ట్ క్వశ్చన్. The agent which is not having a direct bronchodilator action. The agent, so ఇక్కడ ఇవి bronchodilators but it is not having a direct bronchodilator action. అంటే ఈ డ్రగ్స్ అన్ని ఆస్తమాలో వాడతారండి. ఫర్ ఎగ్జాంపుల్ సాల్బిటమాల్, బీటా 2 agonist, అమైనోఫిలిన్, CNS stimulant, but it is a semi-synthetic derivative of theophylline, a bronchodilator. Adrenaline, adrenaline is also having bronchodilator effect. Prednisolone, so prednisolone is a glucocorticoid category, but these glucocorticoids helps in the treatment of asthma, but these are not having direct dilation on bronchial smooth muscle. Direct dilation produce సాల్బిటమాల్, అమైనోఫిలిన్, అడ్రినలిన్ ఇవన్నీ కూడా బ్రాంకియల్ స్మూత్ మజిల్ డైలేట్ చేసి ఆస్తమాలో హెల్ప్ చేస్తాయి. బట్ ప్రెడ్నిసోలోన్ ఏంటి, ఆస్తమాలో సివియర్ ఇన్ఫ్లమేషన్ ఉంటే దాన్ని తగ్గిస్తుంది. ఒకవేళ అలర్జిక్ ఆస్తమా అనేది అలర్జిక్ రియాక్షన్స్ ద్వారా వస్తే ఆ అలర్జిక్ రియాక్షన్స్ ని తగ్గిస్తుంది అనమాట. ఓకే, సో అది ఇక్కడ ఉన్న క్వశ్చన్ కి మీనింగ్. సో ద ఏజెంట్ విచ్ ఈస్ నాట్ హ్యావింగ్ డైరెక్ట్ బ్రాంకోడైలేటర్ యాక్షన్ ఈస్ ప్రెడ్నిసోలోన్. నెక్స్ట్ క్వశ్చన్ చూసుకుంటే కనుక చూస్ ద కరెక్ట్ స్టేట్మెంట్ విత్ రెస్పెక్ట్ టు ద 𝙂𝙄𝙎𝘾𝙄𝑖𝑑. చూస్ ద కరెక్ట్ స్టేట్మెంట్ విత్ రెస్పెక్ట్ టు ద 𝙂𝙄𝙎𝘾𝙄𝑖𝑑. ఇట్ ఈస్ అన్ యాంటీ ఎపిలెప్టిక్ ఓన్లీ యూస్ఫుల్ ఇన్ ద టానిక్ క్లానిక్ సీజర్స్. So choose the correct statement with respect to 𝙂𝙄𝙎𝘾𝙄𝑖𝑑. So 𝙂𝙄𝙎𝘾𝙄𝑖𝑑 is one of the anti-epileptic. Chemically it is commonly known as succinate derivative. So options ఏమి ఇచ్చారండి? Anti-epileptic only useful in the tonic-clonic seizures. Anti-epileptic acts by blocking the sodium channels. It acts by inhibiting the T-type calcium channels. It is useful only in status epilepticus. So choose the correct statement. Yes, it is anti-epileptic but not used in tonic-clonic seizures. It not block the sodium channels and it acts by inhibiting the T-type calcium channels. It is only useful in the status epilepticus. అంటే జనరల్గా చూసుకుంటే కనుక 𝙂𝙄𝙎𝘾𝙄𝑖𝑑 అనేది T-type calcium channels బ్లాక్ చేస్తుందండి. ఈ T-type calcium channels హైపోథాలమస్ లో ఉంటాయి అన్నమాట. CNS హైపోథాలమస్ లో ఉంటాయి. ఈ T-type calcium channels కనుక ఎక్కువగా యాక్షన్ చూపిస్తే ఆప్షన్ సీజర్స్ వస్తాయి. ఆ ఆప్షన్ సీజర్స్ లో జనరల్ గా 𝙂𝙄𝙎𝘾𝙄𝑖𝑑 వాడతారు. ఎందుకంటే 𝙂𝙄𝙎𝘾𝙄𝑖𝑑 మేజర్ గా T-type calcium channels నే బ్లాక్ చేస్తుంది. సో ఇట్ యాక్ట్స్ బై ఇన్హిబిటింగ్ T-type calcium channels. So over activation of this T-type calcium channels in the hypothalamus of CNS produce option seizures. So specific గా ఆప్షన్ సీజర్ లో వాడతారు. ఎందుకంటే ఆప్షన్ సీజర్స్ లోనే ఈ T-type calcium channels యాక్షన్ ఎక్కువ ఉంటుంది. అండ్ మన 𝙂𝙄𝙎𝘾𝙄𝑖𝑑 స్పెసిఫిక్ గా T-type calcium channels మాత్రమే బ్లాక్ చేస్తుంది. ఓకే, నెక్స్ట్ the prostaglandin analog that is useful specifically to treat glaucoma. అంటే ఇక్కడ ఇచ్చినన్ని కూడా prostaglandin derivatives అండి. Prostaglandins like atocoids, they also known as local hormones, and prostaglandins naturally present in the body, they are having different clinical applications. సో ఇందులో మనం చూసుకుంటే మిసోప్రోస్టాల్, అల్ప్రోస్టాడిల్, ఎపోప్రోస్టాల్, లెటనోప్రోస్ట్ ఇవన్నీ కూడా ప్రోస్టాగ్లాండిన్ డెరివేటివ్స్. ప్రోస్టాగ్లాండిన్స్ లాగే యాక్షన్ చూపిస్తాయి. బట్ ఇందులో ఒకటి గ్లాకోమాలో వాడతారని చెప్తున్నారు అనమాట. సో మీ ఆన్సర్ అంటే ఒకసారి చూడండి. సో గ్లాకోమా ఈజ్ ఆల్సో నోన్ యాజ్ ఆక్యులర్ హైపర్ టెన్షన్. అంటే మన బ్లడ్ ప్రెషర్ లో ఎలాగైతే ప్రెషర్ పెరుగుతుందో ఐలో కూడా ఆక్వస్ హ్యూమర్ లెవెల్స్ ఎక్కువైతే, ఆక్వస్ హ్యూమర్ ప్రొడక్షన్ ఎక్కువైతే ఇంట్రాఆక్యులర్ ప్రెషర్ పెరిగి ఆప్టిక్ నర్వ్ డ్యామేజ్ అయ్యి మన విజన్ లాస్ అయ్యే ఛాన్స్ ఉంది. దాన్ని గ్లాకోమా అంటాము. గ్లాకోమా ఇస్ ఆక్యులర్ హైపర్ టెన్షన్. So all these are prostaglandin derivatives. So especially letanoprost, bemetoprost, travoprost, like prost, letanoprost, bemetoprost, travoprost, like this prostaglandin derivatives are analogs, helps in the treatment of glaucoma. Okay, moving to the next question. The bacterial enzyme 𝘎𝑒𝑑𝑖cs present in the intestine causes conversion of the following product to active form of drug. సో ఇక్కడ మనకి G8 లో ఒక బ్యాక్టీరియల్ ఎంజైమ్ ఉంటుందండి, 𝘎𝑒𝑑𝑖cs అని చెప్పేసి. ఆ 𝘎𝑒𝑑𝑖cs అనేది ఇక్కడ ఉన్న వన్ ఆఫ్ ద డ్రగ్స్ ని, ఇన్యాక్టివ్ డ్రగ్స్ ని కాస్త యాక్టివ్ డ్రగ్ గా మారుస్తుందండి. ఆప్షన్స్ మనం చూసుకుంటే కనుక రాబిప్రోజోల్, సల్ఫాసాలజిన్, ఎసైక్లోవిర్, లోవాస్టాటిన్. సో మీ ఆన్సర్ చూడండి. సో లోవాస్టాటిన్ ఉంది. లోవాస్టాటిన్ అంటే జనరల్ గా it is a statin, a hypolipidemic, nothing but anti-hyperlipidemic. ఎసైక్లోవిర్ చూసుకుంటే కనుక వన్ ఆఫ్ ద యాంటీవైరల్ డ్రగ్. సల్ఫాసాలజిన్ సల్ఫోనమైడ్ కేటగిరీలో స్పెషల్ కేటగిరీ కిందకు వస్తుంది. రాబిప్రోజోల్ ఏ ప్రోటాన్ పంప్ ఇన్హిబిటర్ ఫర్ ట్రీట్మెంట్ ఆఫ్ అల్సర్. ఇక్కడ సల్ఫాసాలజిన్ అండి. సల్ఫాసాలజిన్ is a prodrug. Once entering to the GIT in presence of 𝘎𝑒𝑑𝑖cs enzyme, it gives 5-amino-salicylic acid. It gives 5-amino-salicylic acid as well as the sulfapyridine. The sulfapyridine having antibacterial activity, whereas 5-amino-salicylic acid having anti-inflammatory activity. Because of this reason, this 5-sulfasalazine helps in treatment of inflammatory bowel syndrome, a autoimmune disease characterized by ulcerative colitis, Crohn's disease. Ulcerative colitis, Crohn's disease are subtypes of inflammatory bowel disease, a autoimmune disease. In this autoimmune disease, Sulfasalazine useful. This sulfasalazine enter into the GAT, gives 5-amino salicylic acid anti-inflammatory in nature, gives sulfapyridine a antibacterial nature. So answer is very clear. Sulfasalazine is the answer. It is a prodrug. It having poor absorption, so accumulated in the GAT, converts to active form and helps in the treatment of inflammatory bowel disease. Inflammatory bowel disease. Next question. Bradycardia caused by vagal stimulation can be blocked by bradycardia, హార్ట్ రేట్ తగ్గిపోతుంది, హార్ట్ బీట్ తగ్గిపోతుంది. ఎందుకని వన్ ఆఫ్ ద రీజన్ చూసుకుంటే కనుక వేగస్ నర్వ్ స్టిమ్యులేట్ అయితే, ఎందుకని వేగస్ నర్వ్ స్టిమ్యులేట్ అయితే ఎస్టిఎల్ కొలిన్ రిలీజ్ అవుతుందండి. అందుకనే ఎస్టిఎల్ కొలిన్ ని వేగస్ స్టఫ్ అని కూడా అంటారు. సో ఏ స్టఫ్, ఏ మెటీరియల్ రిలీజెస్ వెన్ వేగస్ నర్వ్ ఈజ్ స్టిమ్యులేటెడ్, దట్ ఈస్ ఎస్టిఎల్ కొలిన్. అండ్ ఎస్టిఎల్ కొలిన్ హార్ట్ మీద ఏం చేస్తుందండి, హార్ట్ బీట్ ని, హార్ట్ రేట్ ని తగ్గించి బ్రాడీకార్డియా కాజ్ చేస్తుంది. ఓకే, వేగస్ నర్వ్ స్టిమ్యులేట్ అయితే బ్రాడీకార్డియా వస్తుంది, కరెక్టే. మరి బ్రాడీకార్డ్ ని అపోజ్ చేసే డ్రగ్ ఏంటి ఇక్కడ? ఫినైలెఫ్రిన్, సింపథోమిమెటిక్, మిటోప్రోలాల్ ఏ బీటా బ్లాకర్, ఐట్రోపిన్ ఏ మస్కారినిక్ యాంటగోనిస్ట్, ప్రజోసిన్ ఏ సెలెక్టివ్ ఆల్ఫా-1 బ్లాకర్. సో ఏంటి మీ ఆన్సర్ ఏంటి? ఆల్రెడీ మీ మైండ్ లోకి వచ్చిందా? సో ఇక్కడ బ్రాడీకార్డియా అనేది మనకి వేగస్ నర్వ్ స్టిమ్యులేషన్ ఎస్టిఎల్ కొలిన్ వల్ల వస్తుంది. మరి దానికి ఆపోజిట్ ఎవరు? ఎస్టిఎల్ కొలిన్ యాక్షన్ కి ఆపోజిట్ atropine. Atropine blocks muscarinic receptors on heart. Stimulation of muscarinic receptors on heart because of acetylcholine, it leads to bradycardia, parasympathetic. Atropine is a parasympathetic, blocks M2 receptors on heart and produces tachycardia opposite to acetylcholine. acetylcholine ఏమో bradycardia కాజ్ చేస్తుంది, దాని యాంటగోనిస్ట్ atropine ఏమో tachycardia కాజ్ చేస్తుంది. సింపుల్ అన్నమాట. ఐ హోప్ యు ఆర్ గెటింగ్ మై పాయింట్స్. బేసిక్స్ చాలా ఇంపార్టెంట్ అండి. బేసిక్స్ మనకు తెలిస్తే ఇవన్నీ మనకి ఈజీగా అర్థమవుతాయి అనమాట. ఐ హోప్ యు నో ద బేసిక్స్. నో ప్రాబ్లం. ఆన్సర్ ఇస్ ఆప్షన్ సి. నెక్స్ట్, ఫ్రమ్ paracetamol tablets produced by two manufacturers 500 mg after oral administration in individual, the drug reaches the systemic circulation in similar relative rate and similar extent. The tablet brands are said to be. So from paracetamol tablets produced by two manufacturers after oral administration in the individual, the drug reaches the systemic circulation in similar relative rate and similar extent. The tablet brands are said to be chemical equivalent, bioequivalent, pharmaceutical equivalent, therapeutic equivalent. All are equivalent. But here rate అంటే కాన్సంట్రేషన్ అనేది చాలా ఈక్వల్ గా ఉంటుంది కాబట్టి, సో కాన్సంట్రేషన్ గురించి మనం మాట్లాడేది ఎక్కడ? సింపుల్ గా కాన్సంట్రేషన్ గురించి మనం మాట్లాడేది బయో అవైలబిలిటీ, బయో ఈక్వలెన్స్ అంటే వాటి యొక్క అబ్జార్ప్షన్ జరిగిన తర్వాత రెండు డ్రగ్స్ కూడా సేమ్ కాన్సంట్రేషన్ బ్లడ్ లో ఉన్నాయి కాబట్టి వాటిని బయో ఈక్వలెంట్ సిస్టమ్ అంటాం అనమాట. బయో ఈక్వివాలెంట్, బయో ఈక్వివాలెంట్. ఓకే, ఆన్సర్ ఇస్ ఆప్షన్ బి. నెక్స్ట్, cirrhosis is related to the damage of cirrhosis, liver, heart, brain, spleen. I hope you know the answer. The question is very simple. Cirrhosis is nothing but inflammation of the liver, damage of the liver, hardening of the liver parenchyma. అంటే స్మోకింగ్ ఎక్కువ చేస్తే ఎలాగైతే లంగ్ టిష్యూ అనేది హార్డ్ గా మారిపోతుందో, లివర్ సిరోసిస్ లో లివర్ కూడా అంతే మారిపోతుంది అనమాట. ఎస్పెషల్లీ దేర్ ఆర్ మెనీ రీజన్ లైక్ ఫ్యాటీ లివర్ కావచ్చు, లేకపోతే ఆల్కహాల్ ఎక్కువగా తీసుకోవడం వల్ల కావచ్చు, ఈ లివర్ సిరోసిస్ అనేది వస్తుంది. సో సిరోసిస్ ఈజ్ రిలేటెడ్ టు ద లివర్. నెక్స్ట్ క్వశ్చన్, arterial plaques formed in the blood vessels of heart contribute for arterial plaques deposition of fats, abnormal material in the blood vessel is known as homeostasis, cholestasis, atherosclerosis, aortic stenosis. ఆన్సర్ మీకు తెలుసు, వెరీ సింపుల్. బ్లడ్ వెజల్ లో అబ్నార్మల్ గా లిపిడ్ అక్యుములేట్ అయిపోయి ప్లేక్స్ ఫామ్ అవుతున్నాయి. ఏం ఫామ్ అవుతున్నాయి అంటే ప్లేక్స్ అనేవి ఫామ్ అవుతున్నాయి. సో దాన్ని ఏమంటారు? సింపుల్ గా అథెరోస్క్లెరోసిస్ అంటారు. ఆన్సర్ ఇస్ ఆప్షన్ సి. Moving to the next question, what is that? B cells of the isolates of Langerhans are not functioning and result in the, అంటే ఇప్పుడు మనకు తెలుసు ప్యాంక్రియాస్ లో ఆల్ఫా సెల్స్, బీటా సెల్స్, డెల్టా సెల్స్, ఎఫ్ఎఫ్ఆర్, పిపి సెల్స్ అని ఉంటాయి. వీటిలో బీటా సెల్స్ ఆఫ్ ప్యాంక్రియాస్ కనుక పని చేయకపోతే దానివల్ల ఏమవుతుందండి? డయాబెటీస్ మిలిటస్, డయాబెటీస్ ఇన్సిపిటస్, గెస్టేషనల్ డయాబెటీస్, టైప్ 2 డయాబెటీస్. సో జనరల్ నో దట్ ఫస్ట్ థింగ్ బీటా సెల్స్ రిలీజెస్ ద ఇన్సులిన్. ఇఫ్ బీటా సెల్స్ కనుక సరిగ్గా పనిచేయకపోతే ఇన్సులిన్ తగ్గిపోతుంది. ఇన్సులిన్ తగ్గిపోతే బ్లడ్ లో గ్లూకోజ్ లెవెల్స్ పెరుగుతాయి. ఫస్ట్ కామన్ గా డయాబెటిస్ మిలిటస్ అనేది వస్తుంది. డయాబెటిస్ మిలిటస్ ఇస్ బికాస్ ఆఫ్ decreasing insulin function. Decreasing insulin function, one of the reason is decreasing beta cells function in the pancreas. That leads to domination of glucagon, increase the glucose levels in the blood. Answer is option A. So అది చాలా సింపుల్, మీకు అర్థమైంది. నెక్స్ట్, ఐడెంటిఫై an example for the pharmacokinetic interaction inhibition of metabolism. అంటే ఇక్కడ ఇచ్చిన డ్రగ్ కాంబినేషన్ అనేది ఫార్మకోకైనెటిక్ డ్రగ్ ఇంటరాక్షన్ కాంబినేషన్ గుర్తుపెట్టుకొని ఇచ్చారు. అంటే దాని పాయింట్ లో లైక్ అబ్జార్ప్షన్, డిస్ట్రిబ్యూషన్, మెటబాలిజం, ఎలిమినేషన్, ఫార్మకోకైనెటిక్ డ్రగ్ ఇంటరాక్షన్. అయితే ఇందులో ఉన్న ఒక డ్రగ్ ఇంటరాక్షన్ అనేది మెటబాలిజం ఎఫెక్ట్ చేస్తుంది. చూద్దాం. థియోఫిలిన్ అండ్ ఎరిథ్రోమిసిన్, పెనిసిలిన్, ప్రొబెన్సిడ్, డిగాక్సిన్, వెరాప్మిల్, లివోడోపా, పిరిడాక్సిన్. ఇన్హిబిషన్ ఆఫ్ మెటబాలిజం అంటే డ్రగ్ మెటబాలిజం తగ్గిపోతుంది. డ్రగ్ మెటబాలిజం ఎందుకు తగ్గిపోతుంది? ఎంజైమ్స్ తగ్గిపోవడం వల్ల. ఎంజైమ్స్ అంటే ఏంటి? ఇక్కడ డిక్రీజింగ్ CYP450 ఎంజైమ్స్. అంటే మీకు తెలుసుంటే కనుక మెటబాలిజం గురించి చదివినప్పుడు మీరు జనరల్ ఫార్మకాలజీలో అక్కడ మనకి ఎంజైమ్ ఇండక్షన్, ఎంజైమ్ ఇన్హిబిషన్ ఉంటుందండి. మనం తీసుకునే ఫార్మస్యూటికల్ డ్రగ్స్ లోనే కొన్ని డ్రగ్స్ లివర్ లో ఉన్న మెటబాలిక్ ఎంజైమ్స్ అయిన CYP ఎంజైమ్స్ ని తగ్గిస్తాయి. వాటిని ఎంజైమ్ ఇన్హిబిటర్స్ అంటారు, ఎంజైమ్ ఇండక్షన్ ఇన్హిబిషన్. అండ్ కొన్ని డ్రగ్స్ ఏం చేస్తాయి అంటే కనుక ఆ లివర్ లో ఉన్న మెటబాలిక్ CYP ఎంజైమ్స్ ని ఇంక్రీజ్ చేస్తాయి అనమాట. వాటిని ఏమంటారంటే కనుక ఎంజైమ్ ఇండ్యూసర్స్ అంటారు. అంటే ఎంజైమ్ లెవెల్స్ ని పెంచే డ్రగ్స్ నేమో ఎంజైమ్ ఇండ్యూసర్స్ అంటారు. ఎంజైమ్ లెవెల్స్ ని తగ్గించే డ్రగ్స్ ని ఎంజైమ్ ఇన్హిబిటర్స్ అంటారు. ఇప్పుడు ఎంజైమ్స్ తగ్గిపోవడం వల్ల ఏమవుతుంది? మెటబాలిజం తగ్గిపోతుంది. మెటబాలిజం జరగట్లేదు. సో దానివల్ల డ్రగ్ అనేది బాడీలోనే ఉండిపోతుంది. సో ఇక్కడ ఇన్హిబిషన్ ఆఫ్ మెటబాలిజం బికాస్ ఆఫ్ డిక్రీజింగ్ ఎంజైమ్స్. సో ఈ డ్రగ్స్ లో CYP ఎంజైమ్స్ ఇన్హిబిట్ చేసే డ్రగ్స్ ఏంటో మీకు తెలిస్తే మీకు క్లారిటీ వస్తుంది. థియోఫైలిన్, ఎరిథ్రోమైసిన్, పెనిసిలిన్, ప్రొబెన్సిడ్, డిగాక్సిన్, వెరాప్మిల్, లివోడోపా, పిరిడాక్సిన్. ఈ కాంబినేషన్ లో ఆప్షన్ ఏ అనేది ఈ క్వశ్చన్ కి సూట్ అవుతుంది. ఎందుకంటే ఇక్కడ ఎరిథ్రోమైసిన్ అనే వన్ డ్రగ్ ఉందండి. ఎరిథ్రోమైసిన్ ఇస్ వన్ ఆఫ్ ద యాంటీబయాటిక్ ఇన్హిబిట్ బ్యాక్టీరియల్ ప్రోటీన్ సింథసిస్ బై బైండింగ్ టు 50S రైబోజోమల్ సబ్ యూనిట్. దాంతో పాటు ఈ ఎరిథ్రోమైసిన్ అనేది లివర్ లో ఉన్న CYP450 ఎంజైమ్స్ ని ఇన్హిబిట్ చేస్తుంది. లివర్ లో ఉన్న CYP450 ఎంజైమ్స్ ఇన్హిబిట్ చేసి ఈ డ్రగ్ తో పాటు వేరే డ్రగ్స్ తీసుకుంటే దాని యొక్క మెటబాలిజం తగ్గిస్తుంది. ఈ డ్రగ్ మెటబాలిజం చెప్తే ఏమవుతుంది? బ్లడ్ లో దీని లెవెల్స్ ఎక్కువైపోతాయి. సో థియోఫిలిన్ లెవెల్స్ బ్లడ్ లో ఎక్కువడం వల్ల CNS స్టిమ్యులేషన్ ఎక్సెస్ గా జరిగి ఎపిలెప్సీ వచ్చే ఛాన్స్ ఉంది. ఎక్సెస్ CNS స్టిమ్యులేషన్ మే లీడ్ టు ఎపిలెప్సీ ఆర్ సైకోసిస్. ఈ విధంగా మీరు అర్థం చేసుకోవాల్సి ఉంటుంది అనమాట. ఈ విధంగా మీరు అర్థం చేసుకోవాల్సి ఉంటుంది. అందుకని మీరు ఫార్మకాలజీ ఏ ఫార్మా కాంపిటేటివ్ ఎగ్జామ్ అయినా సరే ఫార్మకాలజీ కీ రోల్ ప్లే చేస్తుంది. ఎస్పెషల్లీ డ్రగ్ ఇన్స్పెక్టర్ ఫార్మసిస్ట్ లో 40%, మోర్ దాన్ 40% క్వశ్చన్స్ ఫార్మకాలజీ రిలేటెడ్ సబ్జెక్ట్స్ నుంచే వస్తున్నాయి. ఫార్మకాలజీ సబ్జెక్ట్ మీరు ఈజీగా అర్థం చేసుకోవాలంటే మీరు జనరల్ ఫార్మకాలజీలో ఫార్మకోడైనమిక్స్, ఫార్మకోకైనెటిక్స్ మీకు పూర్తిగా రావాలి. మ్యాథ్స్ లో ఫార్ములాస్ ఎంత ఇంపార్టెంటో జనరల్ ఫార్మకాలజీలో ఫార్మకోడైనమిక్స్, ఫార్మకోకైనెటిక్స్ అంత ఇంపార్టెంట్. అది మీకు వస్తే కనుక మీకు ప్రతి ఫార్మకాలజీ పాయింట్ ఈజీగా అర్థమవుతుంది. దానికి కావాల్సిన ఇంటెన్షన్, నేను నేర్చుకోవాలి, నేను చదవాలి, నేను క్రాక్ చేయాలని ఇంటెన్షన్ కావాలి. సో దృఢ సంకల్పం అయితే ఖచ్చితంగా కావాలి. ఆన్సర్ ఇస్ వెరీ క్లియర్, ఆప్షన్ ఏ. అండ్ ఐ హోప్ యూ హ్యావ్ దట్ ఇంటెన్షన్. ఎందుకంటే యు ఆర్ ద జెన్ జీ జనరేషన్. మీరు క్వాలిఫికేషన్ కోసం చూడటం ఎప్పుడు కూడా టాప్ ర్యాంక్ చూస్తూ ఉంటారు. అదే కంటిన్యూ చేయండి. సో డెఫినెట్ గా మీరు అనుకుని మీరు సాధిస్తారు, వేరే డౌట్ కూడా లేదు. బట్ యూ షుడ్ బి కాన్ఫిడెంట్. నెక్స్ట్, కాంప్లెక్సేషన్ ఆఫ్ డ్రగ్ అండ్ ఫుడ్ కంపోనెంట్ ఈస్ ఇన్వాల్వ్డ్ ఇన్. అంటే ఇక్కడ ఫుడ్ డ్రగ్ ఇంటరాక్షన్ అండి ఇది. సో ఇక్కడ కాంప్లెక్సేషన్ అనేది ఇన్వాల్వ్ అవుతుంది. మరి ఆప్షన్స్ చూసుకుంటే కనుక టెట్రాసైక్లిన్ వాటర్ ఇంటేక్, టెట్రాసైక్లిన్ మిల్క్ ఇంటేక్, పెనిసిలిన్ జీ వాటర్ ఇంటేక్, పెనిసిలిన్ జీ మిల్క్ ఇంటేక్. ఇది జనరల్ గా మీరు చదవకపోయినా సరే మనకు తెలిసిన విషయమే. టెట్రాసైక్లిన్స్ మిల్క్ తో పాటు తీసుకోకూడదు. కాంప్లెక్సేషన్ జరిగి కాల్షియం అనేది చిలేట్ అయిపోయి టెట్రాసైక్లిన్ మన టీత్ ని, బోన్ ని డ్యామేజ్ చేస్తుంది. సో డోంట్ టేక్ టెట్రాసైక్లిన్స్ అలాంగ్ విత్ మిల్క్. Don't take milk along with tetracyclines, may cause negative damage on the teeth as well as the bone. So దీనికి ఎక్కువ డిస్కషన్ అవసరం లేదు. That is very simple. A food drug interaction involved between the tetracycline and milk. Next question. Therapeutic drug monitoring is not important in the following case. అంటే ఇక్కడ ఇచ్చిన ఆప్షన్స్ లో వన్ ఆఫ్ ద కేస్ లో థెరాపిటిక్ డ్రగ్ మానిటరింగ్ అవసరం లేదంటండి. థెరాపిటిక్ డ్రగ్ మానిటరింగ్ అంటే ఏంటి? ఒక పేషెంట్ కి ఒక డ్రగ్ ఎప్పుడు ఇచ్చాము, మళ్ళీ ఎప్పుడు ఇవ్వాలి, ఎంత డోస్ ఇచ్చాము, ఎంత డోస్ వల్ల అతనికి సేఫ్ గా ఉంటుంది, ఏ డోస్ దగ్గర అతనికి టాక్సిక్ గా ఉంటుంది, ఇవన్నీ చూసుకోవాలన్నమాట. ఇప్పుడు ఐసీయూలో మనకి పేషెంట్స్ ఉంటారు. ఐసీయూ పేషెంట్స్ ఎప్పుడు కూడా రౌండ్ డాక్టర్స్, నర్స్ వాళ్ళంతా చూసుకుంటూ ఉండాలి. ఎందుకంటే అతను క్రిటికల్ కండిషన్ లో ఉన్నాడు. క్రిటికల్ కండిషన్ లో ఉన్నప్పుడు ఇచ్చే ప్రతి డ్రగ్ కూడా చాలా జాగ్రత్తగా మానిటర్ చేసుకోవాలి. మానిటరింగ్ చేసుకోలేదనుకోండి, ఓవర్ డోస్ అయినా సరే అతనికి ప్రాబ్లం అవుతుంది, డోస్ సరిగ్గా ఇవ్వకపోయినా సరే ప్రాబ్లం అవుతుంది. సో మానిటరింగ్ చాలా ఇంపార్టెంట్ అనమాట. కానీ అటువంటి మానిటరింగ్ అనేది ఇక్కడ ఇచ్చిన ఒక డ్రగ్ కి అవసరం లేదని చెప్తున్నాడు. లైక్ క్లోజపైన్ థెరపీ సైకోస్ ట్రీట్మెంట్ లో వాడతారు. సైక్లోస్పోరిన్ థెరపీ ఇమ్యూనో సప్రెసెంట్ గా ఆర్గాన్ ట్రాన్స్ప్లాంటేషన్ లో కానీ ఆటో ఇమ్యూన్ డిసీజ్ లో కానీ వాడతారు. డిగాక్సిన్ థెరపీ ఏ డ్రగ్ ఫర్ ట్రీట్మెంట్ ఆఫ్ కంజెస్టివ్ హార్ట్ ఫెయిల్యూర్. పారాసెటమాల్ థెరపీ ఇక్కడ మనం చూసుకుంటే ఏంటి, పారాసెటమాల్ కొంచెం నార్మల్ డ్రగ్, కామన్ డ్రగ్, ఇది జనరల్ గా మనం తీసుకునే డ్రగ్. సో దీన్ని వాడేటప్పుడు మానిటరింగ్ అంత అవసరం లేదు అని చెప్తున్నాడు. కానీ పారాసెటమాల్ ఓవర్ గా యూజ్ చేసినా గానీ హెప్టోటాక్సిక్ డ్యామేజ్ వస్తుంది. ఆ హెప్టోటాక్సిక్ లో యాంటీడోట్స్ యూజ్ చేస్తారు. బట్ సైకోసిస్ ఏ సివియర్ డిసీజ్ అండ్ ఇమ్యూనో సప్రెషన్, ఇమ్యూన్ సిస్టమ్ సప్రెస్ అయ్యే ఛాన్స్ ఉంది. సో చాలా జాగ్రత్త చూసుకోవాలి. డిగాక్సిన్ హార్ట్ మీద ఎఫెక్ట్ చూపిస్తుంది, చాలా జాగ్రత్త చూసుకోవాలి. ఏబిసి మానిటరింగ్ కంపల్సరీగా ఉండాలి. పారాసెటమాల్ లేకపోయినా పర్లేదు, ఎందుకంటే ఇది అంత డేంజరస్ డ్రగ్ కాదు కాబట్టి. ఓకే, బట్ ఏదైనా సరే ఓవర్ ద లిమిట్ ఇట్ ఈస్ పాయిజనస్ ఇన్ నేచర్. ద ఆన్సర్ ఇస్ వెరీ క్లియర్, పారాసెటమాల్ థెరపీ. నెక్స్ట్ క్వశ్చన్, ప్రోటీన్ బైండింగ్ ఆఫ్ డ్రగ్. సో ఫర్ ఎగ్జాంపుల్ మీకు తెలుసు, ఆల్రెడీ మీరు డ్రగ్ డిస్ట్రిబ్యూషన్ చదువుకుంటారు జనరల్ ఫార్మకాయిల్లో. అక్కడ ప్లాస్మా ప్రోటీన్స్ డ్రగ్ యొక్క డిస్ట్రిబ్యూషన్ ని కీ రోల్ ప్లే చేస్తాయి. ఇప్పుడు ఒక డ్రగ్ అనేది ప్లాస్మా ప్రోటీన్ కి బైండ్ అయింది అనుకోండి, సో ఈ డ్రగ్ ఏదైతే ప్లాస్మా ప్రోటీన్ కి బైండ్ అయిందో దిస్ ఈస్ హ్యావింగ్ లెస్ డిస్ట్రిబ్యూషన్ త్రూ అవుట్ బాడీ ఫ్లూయిడ్స్. ఎందుకంటే దీని మాలిక్యులర్ రేట్ ఎక్కువ కాబట్టి ఇది బాడీ ఫ్లూయిడ్స్, బాడీ కంపార్ట్మెంట్స్ ఈజీగా క్రాస్ చేయలేదు. లేదు డ్రగ్ ఫ్రీగా ఉందనుకోండి, అది ఫ్రీగా మెంబ్రెన్స్ ని క్రాస్ చేస్తుంది, బాడీలో డిస్ట్రిబ్యూషన్ కూడా ఉంటుంది. సో ప్రోటీన్ బైండింగ్ ఆఫ్ డ్రగ్ affects pharmacokinetic of the drug only, affects pharmacodynamic of the drug only, affects pharmacokinetics and pharmacodynamics of the drug only. అలాగే no effect on the pharmacokinetics and pharmacodynamics of the drug. I hope మీకు ఆన్సర్ వచ్చేసింది అనుకున్నాను ఆల్రెడీ. సో ఒక డ్రగ్ అనేది ప్లాస్మా ప్రోటీన్ కి బైండ్ అవడం అనేది ఫార్మకోకైనెటిక్స్ ని డిటర్మైన్ చేస్తుంది, ఫార్మకోడైనమిక్స్ ని డిటర్మైన్ చేస్తుంది. ఎందుకంటే డ్రగ్ బైండింగ్ టు ప్లాస్మా ప్రోటీన్ డస్ నాట్ మూవ్ అవ్వలేదంటే కైనెటిక్స్ లేవు, అది మూవ్ అవ్వలేదంటే టిష్యూ దగ్గరికి వెళ్ళట్లేదు, యాక్షన్ కూడా చూపించట్లేదు. సో డ్రగ్ అనేది ప్లాస్మా ప్రోటీన్ తో బైండ్ అయి ఉంటే కనుక అది మాలిక్యులేట్ లార్జ్ గా ఉంటుంది. లార్జ్ మాలిక్యులేట్ అనేది మెంబ్రెయిన్స్ ని క్రాస్ చేయలేదు. సో మెంబ్రెయిన్ క్రాస్ చేయలేనప్పుడు అది దాని టిష్యూని రీచ్ అవ్వదు, యాక్షన్ కూడా చూపించలేదు. యాక్షన్ ఈస్ డైనమిక్స్, కైనెటిక్స్ ఈస్ మూవ్మెంట్. సో డ్రగ్ బైండింగ్ టు ప్లాస్మా ప్రోటీన్ ఎఫెక్ట్స్ ఫార్మకోకైనెటిక్స్ యాజ్ వెల్ యాజ్ ఫార్మకోడైనమిక్స్. సో డ్రగ్ మూవ్ అయ్యి టిష్యూ దగ్గరికి వెళ్తేనే యాక్షన్ చూపిస్తుంది. ఇప్పుడు డ్రగ్ మూవ్ అవ్వలేదు అనుకోండి, ఫార్మకోకైనెటిక్స్ లేవు, డైనమిక్స్ కూడా లేవు. సో ప్రోటీన్ బైండింగ్ ఆఫ్ ఎ డ్రగ్ determine both pharmacokinetics as well as pharmacodynamics. Next, cholera vaccine is manufactured by the cultivating Vibrio cholera in. So Vibrio cholera is organism causing cholera, and cholera vaccine is manufacturing by cultivating the Vibrio cholera in Aerosol cultures, chick embryo, rabbit, a suitable nutrient medium. So ఇటువంటి క్వశ్చన్స్ కొంచెం అద్దెగా మనం చూస్తూ ఉంటాము, అండ్ దీస్ ఆర్ లైక్ సమ్ యూనిక్ లైక్ క్వశ్చన్స్. సో ఇక్కడ ఎలా మ్యానుఫ్యాక్చర్ చేస్తారంటే ఏ సూటబుల్ న్యూట్రియంట్ మీడియం యూజ్ చేసుకుని మ్యానుఫ్యాక్చరింగ్ అనేది చేస్తారు. నెక్స్ట్ క్వశ్చన్, monoclonal antibodies are antibodies produced by single clone of T lymphocytes, antibodies produced by the single clone of B lymphocytes, antibodies produced by the multiple clones of B lymphocytes, antibodies produced by the multiple clones of T lymphocytes. Monoclonal antibodies. So there are n number of examples are there, like tocilizumab, imamimab. So n number of examples are there on monoclonal antibodies. So these monoclonal antibodies are, so monoclonal antibodies simple ga entante ganaka, so they are especially produced by the immune system components, like these are antibodies produced by the single clone of B lymphocytes. Monoclonal antibodies. Monoclonal antibodies. So remember, antibodies releases from the B cells. So B cells నుంచి B lymphocytes నుంచి మనకి ప్లాస్మా సెల్స్ వస్తాయి, ఆ ప్లాస్మా సెల్స్ నుంచి మనకి యాంటీబాడీస్ వస్తాయి. సో రిమెంబర్, monoclonal antibodies are nothing but they're antibodies produced by the single clone of B lymphocytes. B lymphocytes నుంచి plasma cells వస్తాయి, plasma cells నుంచి antibodies వస్తాయి like IgG, IgA, IgM, IgD. ఓకే, గుర్తుపెట్టుకోండి. B cells, plasma cells, antibodies. But monoclonal antibodies are not part of T cells. These are clone of B lymphocytes, single clone of B lymphocytes. That is monoclonal antibodies. Next, tetanus antitoxin is a serum containing antibody against gas gangrene toxin, serum containing antibodies against diphtheria, serum containing antibodies against tetanus toxin, serum containing antibodies against the snake venom. So these are questions from the point of microbiology as well as biotechnology. సో ఎక్కువగా చాలా మంది స్టూడెంట్స్ కూడా బయోటెక్నాలజీ ప్రిఫర్ చేయరు, బట్ మీరు చదవండి. చదివేది కూడా ఏ ఏరియాస్ నుంచి బిట్స్ వచ్చే ఛాన్స్ ఉందో వాటి నుంచి అయితే కంపల్సరీగా చదవండి. ఆల్రెడీ మీరు చదవకపోతే కనుక టెన్షన్ పడద్దు, ఇఫ్ యువర్ విష్. ఓకే, సో ద ఆన్సర్ ఫర్ దిస్ tetanus antitoxin is a serum containing antibody against tetanus toxin. Tetanus antitoxin against the tetanus toxin. Next, identify the pair of live attenuated vaccines BCG Colmetta Bacillus colmetigorum, oral polio vaccine, rabies vaccine, hepatitis vaccine. సో ఇందులో లైవ్ అటెన్యూటెడ్ వ్యాక్సిన్స్ అంటే చెప్తున్నాను అనమాట. సో ఈ క్లాసిఫికేషన్ చాలా ఇంపార్టెంట్ అండి. మన GDC బుక్స్ లో అయితే మీకు క్లియర్ కనిపిస్తుంది. అండ్ ఇక్కడ లైవ్ అటెన్యూటెడ్ వ్యాక్సిన్స్ వచ్చేసి 1 and 2 BCG Bacillus colmetigorum, oral polio vaccine nothing but also known as sabin vaccine. So oral polio or sabin vaccine and BCG vaccine are belongs to live attenuated vaccines. Identify the inactivated viral vaccine from the following: oral polio vaccine, rabies vaccine, hepatitis B/AG, diphtheria toxin. Identify the inactivated viral vaccine from the following: viral vaccine. So oral polio, rabies, hepatitis, diphtheria. Okay. So ఏదండి ఇందులో ఆన్సర్ క్లియర్ గా? So the answer is very clear. That is rabies vaccine is inactivated viral vaccine from the following. Next question. Alum in alum precipitated toxin function as adjuvant, precipitating agent, complement, antigen. So alum precipitated toxide function as a adjuvant supportive agent, precipitating agents, complementing agent, antigen agent. Generally it is like a supporting agent, that is adjuvant nothing but a supporting agent. Next, okay, the question is repeated, I think so. Okay, here low molecular weight antigenic determinant is known as. So low molecular weight antigenic determinant is commonly known as a hapten. It is commonly known as a hapten, like adjuvant, carrier, hapten, nothing but hapten or Hagen vehicle. So that is a low molecular weight antigenic determinant. ఇవన్నీ కూడా చిన్న చిన్న డెఫినేషన్స్ లాంటివి గుర్తుపెట్టుకోండి. లో molecular weight antigenic determinant is hapten. Determinant, antigenic determinant, hapten. Next, serum substance that facilitates phagocytosis is known as opsonine, precipitin, agglutinin, prothrombin. Prothrombin అనేది clotting అవుతుంది, agglutination, precipitation. Serum substance that facilitates the phagocytosis is known as opsonine. Opsonine phagocytosis is a serum substance that facilitates, that promotes phagocytosis. సో జనరల్ ఇక్కడ ఆన్సర్ అనేది ఇవ్వలేదండి, బట్ ఆన్సర్ ఇస్ ఆప్సోనిన్. మీరు గుర్తుపెట్టుకోండి, ఈ క్వశ్చన్ ఆన్సర్ అనేది ఆప్సోనిన్. నెక్స్ట్ క్వశ్చన్, antigen antibody reaction of toxin and antitoxin is neutralization, precipitation, agglutination, opsonization. So antigen antibody reaction between toxin and antitoxin అనేది ఏంటి? జనరల్ గా న్యూట్రలైజేషన్ చేస్తుంది. సో న్యూట్రలైజేషన్, యాంటీజన్ యాంటీబాడీ రియాక్షన్ ఆఫ్ టాక్సిన్ అండ్ యాంటీటాక్సిన్ ఇస్ న్యూట్రలైజేషన్, ప్రెసిపిటేషన్, అగ్లుటినైజేషన్. Opsonization. The answer is neutralization. Antigen antibody reactions leads to the neutralization of the response. Next question. So regarding the next question, if a child gets vaccinated against microbial disease, immunity is known as acquired immunity active, acquired immunity artificial passive, natural immunity, artificial immunity. If a child gets vaccinated against the microbial disease, the immunity is known as acquired immunity active artificial, acquired immunity artificial passive, నేచురల్ ఇమ్యూనిటీ యాజ్ వెల్ యాజ్ ఆర్టిఫిషియల్ ఇమ్యూనిటీ. జనరల్ ఇక్కడ మనం చూసుకుంటే కనుక ఇక్కడ వ్యాక్సిన్స్ ఇచ్చి అతనికి ఇమ్యూన్ సిస్టమ్ ని స్ట్రెంథెన్ చేస్తున్నాం కాబట్టి అక్వైర్డ్ ఇమ్యూనిటీ యాక్టివ్ ఆర్టిఫిషియల్, అక్వైర్డ్ ఇమ్యూనిటీ యాక్టివ్ ఆర్టిఫిషియల్. అంటే ఇక్కడ మనం వ్యాక్సిన్ ఇచ్చి అతని ఇమ్యూన్ సిస్టమ్ ని స్ట్రెంథెన్ చేస్తున్నాం, మనమే ఇస్తున్నాం అక్వైర్డ్ అండ్ యాక్టివ్ ఆర్టిఫిషియల్. నెక్స్ట్, streptomycin is antibiotic like polyene antibiotic, macrolide antibiotic, beta-lactam antibiotic, aminoglycoside antibiotic. Streptomycin is antibiotic. So polyene, macrolide, beta-lactam, aminoglycoside. So polyene, example like amphotericin be antifungal, macrolide, erythromycin, clarithromycin, azithromycin, beta-lactam antibiotics, penicillin, cephalosporins, carbapenems, monobactam. And aminoglycoside is streptomycin is a aminoglycoside, amino sugar. This amino sugars binds to 30S ribosomal subunits of bacteria and inhibit protein synthesis in the bacteria. So answer is option D. Next, dash is the minor metabolite which is both neurotoxic and urotoxic formed from the cyclophosphamide or ribophosphamide metabolism. So one of the toxic metabolite is a neurotoxic as well as urotoxic. Urotoxic means damage the kidney or urinary system. Formed from the cyclophosphamide or ifosfamide, one of the anti-cancer drug. Chloroacetaldehyde, azidenum cation, carbonyl amino, hydroxycyclophosphamide, hydroxycyclophosphamide. So ఇక్కడ ఇచ్చిన టాక్సిక్ మెటాబోలైట్స్ అనేవి ఇది సైక్లోఫాస్ఫమైడ్ నుంచి ఇఫోస్ఫామైడ్ నుంచి వచ్చే ఛాన్స్ ఉంది. అవి న్యూరోటాక్సిక్, న్యూరాన్స్ డ్యామేజ్ చేస్తున్నాయి, యూరోటాక్సిక్ కిడ్నీని కూడా డ్యామేజ్ చేస్తున్నాయి. అది ఏంటి? సో దట్ ఈస్ సింప్లీ chloroacetaldehyde. That is simply chloroacetaldehyde, a toxic metabolite. Next, the drugs useful in the treatment of hyperthyroidism: methimazole, levothyroxine, acarbose, 𝘂𝙎𝙎𝙎𝙎𝙬 sodium. Hyperthyroidism, higher levels of T3, T4 hormones in the blood. మరి హైపర్థైరాయిడిజం కంట్రోల్ చేయాలంటే, తగ్గించాలంటే ఏ డ్రగ్ వాడతారు ఇక్కడ? ఫర్ ఎగ్జాంపుల్ లివోథైరోనిన్. లివోథైరోనిన్ అనేది థైరాయిడ్ సప్లిమెంట్. హైపోథైరాయిడిజం లో వాడతారు, అంటే T3, T4 సరిగ్గా లేకపోతే హైపోథైరాయిడిజం లో ఇవి వాడతారు. అకార్బోజ్, అకార్బోజ్ ఇస్ అన్ హైపోగ్లైసెమిక్, యాంటీ డయాబెటిక్. అండ్ లెవోథైరాక్సిన్, లివోథైరాక్సిన్ కూడా హైపోథైరాయిడిజం లో T3, T4 కావాల్సింది లేకపోతే వాడతారు. మెథిమజోల్, కార్బెమజోల్, these are the drugs helps in the treatment of hyperthyroidism by preventing T3, T4 excess levels in the blood. So methimazole, carbimazole, they helps in the treatment of hyperthyroidism. Answer is methimazole. Next, the angiotensin 2 blocker which contains benzimidazole moiety. ఇక్కడ ఇచ్చినన్ని కూడా దే ఆర్ యాంజియోటెన్సిన్ 2 రిసెప్టార్ బ్లాకర్. సో లైక్ సార్టాన్స్, సో లోసార్టాన్, వాల్సార్టాన్, ఇర్బిసార్టాన్, టెల్మిసార్టాన్, ఇవన్నీ కూడా యాంటీ హైపర్టెన్సివ్ గా వాడతారు. అండ్ కానీ ఇక్కడ అడిగిన క్వశ్చన్ ఏంటంటే కనుక ఈ డ్రగ్స్ లో ఒకదానికి బెంజిమిడజోల్ గ్రూప్ అనేది ఉంటుంది దాని స్ట్రక్చర్ లో. సో లోసార్టానా, వాల్సార్టానా, ఇర్బిసార్టానా, టెల్మిసార్టానా. సో రిమెంబర్, బెంజిమిడజోల్ ప్రెసెంట్ ఇన్ ద టెల్మిసార్టాన్, బెంజిమిడజోల్ ప్రెసెంట్ ఇన్ ద టెల్మిసార్టాన్. సో మీరు చదివేటప్పుడు ఫార్మకాలజీ చదివేటప్పుడు మెడిసిన్ కెమిస్ట్రీ టెక్స్ట్ కూడా పక్కన పెట్టుకొని చూడండి టెల్మిసార్టాన్ డ్రగ్ ఎలా ఉంది. జస్ట్ మెయిన్ ఇంపార్టెంట్ గ్రూప్స్ ఉంటాయి, అవి మీరు గుర్తుపెట్టుకోవాలి. ఇప్పుడు ఫర్ ఎగ్జాంపుల్ రిసెప్టిన్ ఇండోల్ గ్రూప్ ఉంటుంది, పైలోకార్పిన్ ఇమిడజోల్ గ్రూప్ ఉంటుంది. అట్లా మీరు ఎక్కువ కష్టపడాల్సిన పని లేదు. చక్కగా మీరు ఫార్మకాలజీ చదివేటప్పుడు మెడిసిన్ కెమిస్ట్రీ కూడా ఫోకస్ చేస్తే మీకు ఇంకా ఈజీ అవుతుంది అనమాట, చాలా ఈజీ అవుతుంది. ఆ అప్రోచ్ మీకు చాలా ఉపయోగపడుతుంది. ఈ పీజీ సెట్కే కాదు, రాబోయే ఫార్మసిస్ట్, డ్రగ్ ఇన్స్పెక్టర్స్ కి మీ అప్రోచ్ ఫాలో అవ్వండి. అండ్ ఎట్ ఎనీ టైం మీకు తెలుసు, సో మీకు ఎటువంటి గైడెన్స్ కావాలన్నా, ఎటువంటి హెల్ప్ కావాలన్నా సరే ప్రిపరేషన్ పరంగా, సో ఐఎమ్ రెడీ టు హెల్ప్ యూ. సో దిస్ ఈజ్ మై కాంటాక్ట్ నెంబర్ 7995318103, 7995318103. అండ్ ఈవెన్ మీరు కోచింగ్ ఏదైనా చూస్తున్నా కూడా డెఫినెట్గా నాకు కాల్ చేయండి, డెఫినెట్గా మీకు హెల్ప్ చేస్తాను. నెక్స్ట్, which one of the barbiturate is long acting? Secobarbital, pentobarbital, phenobarbital, thiopental. సో జనరల్ గా మనకి బార్బిట్రేట్స్ క్లాసిఫికేషన్ డ్యూరేషన్ బేస్ చేసుకుని ఉంటుందంటే లాంగ్ డ్యూరేషన్, షార్ట్ డ్యూరేషన్, ఇంటర్మీడియట్ డ్యూరేషన్, అల్ట్రా షార్ట్ యాక్టింగ్. కమింగ్ టు ద సెకోబార్బిటల్ is a short acting, pentobarbital also short acting, thiopental is ultra short acting, and phenobarbital, mephobarbital are long acting barbiturates. Phenobarbital, mephobarbital are long acting barbiturates. Phenobarbital, mephobarbital are long acting barbiturates. Answer is option C. And next, combination of amoxicillin and clavulanic acid result in the increase in potency against beta-lactamase releasing strains, prolonged duration of action, acid stability, orally effective. So amoxicillin, one of the amino penicillin, effective on gram positive as well as gram negative bacterial infections. అయితే ఈ అమాక్సిలిన్ అనేది పెన్సిలిన్ సంబంధించింది అనమాట. పెన్సిలిన్స్ లో ఉన్న వన్ ఆఫ్ ద డ్రాబ్యాక్ ఏంటంటే కనుక ఇది బాడీలోకి వెళ్ళినప్పుడు ఆర్గానిజం మీద యాక్ట్ చేసేటప్పుడు ఆ ఆర్గానిజం బీటా లాక్టమేజ్ అనే ఎంజైమ్ ప్రొడ్యూస్ చేస్తుంది. ఈ బీటా లాక్టమేజ్ అనే ఎంజైమ్ ఈ అమాక్సిలిన్ లో పెన్సిలిన్స్ లో ఉన్న యాక్టివ్ బీటా లాక్టమరిన్ ని క్లీవ్ చేసి వాటిని ఇన్యాక్టివ్ చేసేస్తాయి అనమాట, పనిచేయకుండా చేస్తాయి. బీటా లాక్టమేజెస్ ఆర్ ద ఎంజైమ్స్, they release from the microorganisms. This beta lactamases inactivate beta lactam ring in the penicillins and cause inactivation of penicillins. So అది జరగకుండా ఉండాలంటే అమాక్సిలిన్ తో పాటు క్లావలినిక్ యాసిడ్ అనే బీటా లాక్టమేజ్ ఎంజైమ్ ఇన్హిబిటర్ ఇస్తే ఏమవుతుందంటే ఇంక్రీజ్ ఇన్ ద పొటెన్సీ ఆఫ్ డ్రగ్స్ అగైనెస్ట్ బీటా లాక్టమేజ్ రిలీజింగ్ స్ట్రెయిన్స్. సో బీటా లాక్టమేజ్ రిలీజ్ అయినా కూడా ఈ క్లావలినిక్ యాసిడ్ బీటా లాక్టమేజ్ ఇన్హిబిట్ చేసి ఈ పెనిసిలిన్స్ ని ఇన్యాక్టివ్ కాకుండా చూసుకుంటుంది. So combination of amoxicillin plus clavulanic acid result in increase in potency against beta lactamase releasing strains and డ్యూరేషన్ కూడా ప్రొలాంగ్ చేస్తుంది. ఇప్పుడు బీటా లాక్టమేజ్ డ్రగ్స్ ఇన్యాక్టివ్ అవ్వట్లేదంటే ఎక్కువసేపు బాడీలో ఉంటాయి, ఎక్కువసేపు యాక్షన్ చూపిస్తే కాబట్టి డ్యూరేషన్ కూడా పెరుగుతుంది. బట్ ఇక్కడ ఆన్సర్ అనేది జనరల్ ఏంటంటే కనుక ఆన్సర్ బిలాంగ్స్ టు ద సింప్లీ ఆప్షన్ ఏ. ఆన్సర్ బిలాంగ్స్ టు ద సింప్లీ ఆప్షన్ ఏ. సో దిస్ ఈస్ ఆన్సర్ ఫర్ దిస్ ఆన్సర్. Choose the correct statement with regard to use of calcitriol. It is an active form of vitamin D found in the body. It is used especially when immediate effect is desired in severe deficiency. It is used to treat phosphatemia and hypercalcemia found in the hyperthyroidism. It is useful in hypocalcemia resulted from the vitamin D deficiency. So calcitriol, one of the active form of vitamin D. Calcitriol, one of the active form of vitamin D. So it is నథింగ్ బట్ ఇక్కడ డిఫరెంట్ ఆప్షన్స్ ఇచ్చున్నారు, ఒకసారి మీరు గమనించండి. ఓకే, సో సింపుల్ గా మీరు గమనిస్తే కనుక సో ద ఆన్సర్ ఫర్ దిస్ MCQ is regarding the calcitriol used to treat hyperphosphatemia and hypercalcemia found in hyperparathyroidism. Hyperparathyroidism లో ఫాస్ఫేట్ లెవెల్స్ ఎక్కువ ఉంటాయి, కాల్షియం లెవెల్స్ ఎక్కువ ఉంటాయి. వాటిని కంట్రోల్ చేయడానికి, రెగ్యులేట్ చేయడానికి calcitriol ని యూజ్ చేస్తారు. వన్ ఆఫ్ ద యాక్టివ్ ఫార్మ్ ఆఫ్ విటమిన్ డి, వన్ ఆఫ్ ద యాక్టివ్ ఫార్మ్ ఆఫ్ విటమిన్ డి. సో ఆప్షన్ సి ఇస్ ద ఆన్సర్. సో ఇది ఈ సెషన్ లో ఫార్మకాలజీకి సంబంధించిన క్వశ్చన్స్, వాటి యొక్క ఆన్సర్స్. ఐ హోప్ యు ఆర్ వెరీ క్లియర్. సో మీ ప్రిపరేషన్ అదే విధంగా కంటిన్యూ చేయండి, అసలు తగ్గొద్దు, తగ్గించొద్దు కూడా. సో ఏమున్నా కూడా ముందుకు తీసుకెళ్ళండి అండ్ కాన్ఫిడెంట్ గా ఉండండి. డెఫినెట్ గా కాన్ఫిడెన్స్ అనేది మిమ్మల్ని ముందుకు నడిపిస్తుంది. ఆల్ ది బెస్ట్. థ్యాంక్ యూ సో మచ్ ఫర్ కోఆపరేషన్.
Hello everyone, welcome to the GDC English YouTube channel. So in today's session, what we were discussing about the previous year question paper from Telangana PGECET examination. Okay, so I'm going to take your pharmaceutical chemistry portion and we will discuss the previous year question that have been asked in Telangana PGECET examination and we will solve the question from pharmaceutical chemistry. Okay, so let's start the session. First question, what the first question is saying? First question is saying identify the projected area diameter. Okay, so the question is related with the pharmaceutics, but we can discuss it regarding that, like what is the projected area diameter. So in your physical pharmaceutics, you have studied that in order to measure the particle diameter, there are multiple ways to measure the particle diameter. The first one is your projected area diameter, the second one is your Stokes diameter, volume diameter. Multiple methods are there. Okay, so let's read the option. The first one is your, it is the diameter of sphere having the same surface area that of what? Same surface area that of asymmetric particle. So if it is having the same surface area, then it will become what? Then it will become surface diameter. It will become what? It will become surface diameter. It will not become projected area diameter. Next, it is the diameter of the sphere having same volume as of asymmetric particle. If it is having the same volume as of asymmetric particle, then it will become what? Then it will become volume diameter. Simple. It will become volume diameter. Next, it is a diameter of circle with same area as that of the particle observed perpendicular to the surface on the which the particle is resting. So this is what? This is your projected area diameter. Next one is your, it is the diameter of an equivalent sphere undergoing the sedimentation at the same rate. So in case of sedimentation, which law is applied? In case of sedimentation, your Stokes law is applied. So this diameter will become what? This diameter will become your Stokes diameter. This will become what? This will become your Stokes diameter. Simple. So the right answer for this question will be what? The right answer for this question will be your option number C. Okay, option number C is the right answer for this question. Okay, so what is the your projected area diameter? Projected area diameter is what? It is the diameter of circle with the same area as that of the particle observed perpendicular to the surface on which the particle is resting. Okay, so now the clear. Okay, next question, question number 78. What the question number 71 is saying? Purity and polymorphism can be established by, means how we can establish or measure the purity and polymorphism. So the first option is your DSC, that is differential scanning calorimetry. The second option is your TGA. The third option is your TMA, and the fourth option is your DTA. Okay, so what is used? So your TGA, that is thermogravimetric analysis, it is used to what? It is used to measure the weight loss with temperature. It measures your weight loss of the compound with increase in temperature. When we increase the temperature, then moisture gets lost and weight loss will happen. So that is measured by using TGA. Now TMA measures what? TMA measures your dimensional changes. It measures what? It measures your dimensional changes. It measures your dimensional changes, whereas your DSC, that is differential scanning calorimetry, it measures what? It measures your, let me clear the screen. DSC measures what? It measures your melting point. The first thing is measured by is it measures your melting point. Then after that it measures your crystal transitions, the change in crystal, like crystalline from whether it is crystalline, whether it is amorphous, that transition is measured by your DSC. Polymorphic form is also measured by your DSC. The polymorphic changes can be measured by using your DSC. And at the end, we can also check what? Purity changes, whether the purity impurity is present or not. This can be also checked by using DSC. So purity and polymorphism can be established by using what? By using your option number A, that is differential scanning calorimetry. So the correct answer for this question will be your option number A. Okay, so the right answer will be your option number A. Next question, Keystone forces are attractions between. Keystone forces are attraction between. The first option is your dipole. The second option is your dipole and induced dipole. The third option is your induced dipole. And fourth option is your ion induced dipole. So if there is ion induced dipole, if there is between ion induced dipole, it is what? It is a separate electrostatic interaction. It is what? It is a separate electrostatic interaction. And if we talk about induced dipole, that is what? That is your ID. What is ID and ID? So when we go in any foreign country, they want what? They want your ID passport. So that ID is what? That ID is your London forces. That ID is your London forces. And if we talk about dipole induced dipole, then this is what? This is your Debye forces. Dipole induced dipole, this is your Debye forces. And dipole, that is your Keystone forces. So dipole will be Keystone forces. Dipole induced dipole will be your Debye forces. And induced dipole, that is your ID is what? It will become your London forces. So the correct answer for this question will be your option number A. That is what? That is your dipole. So if we talk about the strength, that is stronger, who is stronger? The first highest order gets by starting with ion, then ion dipole, then hydrogen bond, then dipole, then your London forces, that is your induced dipole. Okay, now next question, question number 73. What the question number 73 is saying? Which electrode is used in a conductivity cell? Okay, so which electrode we can use in a conductivity cell? The first option is your platinum electrode, the second option is your silver chloride electrode, the third option is your glass electrode, and fourth option is your dropping mercury electrode. So here in conductivity cell, if we talk about what? If we talk about the dropping mercury electrode, we use it in where? We use it in polarography. Your dropping mercury electrode is used in polarography. Dropping mercury electrode is used in polarography. And if we talk about the glass electrode, it is used in case of pH measurement. It is used in pH measurement. We use glass electrode in pH measurement. And if we talk about silver chloride electrode, we use the silver chloride electrode as an reference electrode. Silver chloride electrode can be used as an reference electrode. And if we talk about the platinum electrode, that's why we can use the platinum electrode in conductivity cell. Why we can use the platinum electrode? First reason is it is chemically inert. Platinum electrode is chemically inert and it is good conductor, and it minimizes your polarization effects. It minimizes your polarization effects. Okay, so the correct answer for your question number 73 will be what? The correct answer will be your option number A, that is the platinum electrode. Okay, simple. Now, and one more thing, there it is using conductivity cell. So there are some factor in which the conductivity is depending upon. The conductivity depends upon some factor. The first one is what? The first one is your number of ions. How many ions are there? And what is the mobility of the ion? This is very important. Number of ions, mobility of the ions, and well as temperature. And you have to study about the relation, that is K is what? K, that is conductivity is what? Conductivity is inversely proportional to your what? Inversely proportional to resistivity. Conductivity is inversely proportional to resistivity. Okay, next question. Question number 74. What the question number 74 is saying? In electrophoresis, the amphoteric substances such as protein. The protein is what? Protein is an amphoteric substance. So they are saying if we are conducting what? Conducting an electrophoresis, so amphoteric substances such as proteins. The first option is the direction of migration is independent of pH of buffer. The second one is better separation is achieved using weakly alkaline buffers. Third option is better separation is achieved using weakly acidic buffer. And the last option is direction of migration depends upon whether the buffer is pH is above or below the isoelectric point of sample. So what will be the right answer? First option. The first option is saying the direction of migration is independent of the pH buffer. No, the direction of migration will definitely depend upon the pH. It was not the independent. Okay. Next is buffer separation is achieved using weakly alkaline or weakly acidic. No, both are not. We can use depending upon the condition. So not the weakly alkaline, not the weakly acidic. Yes, this option is saying direction of migration depends upon whether the pH buffer is above or below the isoelectric point of the sample. Why happened this? Let me tell you. If we talk about if that is below isoelectric point, if it is below isoelectric point, then what will happen? Then there will be positively charged. Below isoelectric point, there will be what? There will be positively charged. Below isoelectric point, there will be positively charged, and this positively charged substance will do what? They will move towards where? They will move towards cathode. Positively charged, they will move towards cathode. And if we talk about what? If we talk about the above that point, then above isoelectric point, they will become what? They will become negatively charged. They will become what? They will become negatively charged, and they will move towards what? They will move towards anode. Simple. So that's why it depends on the isoelectric point. Okay, and at isoelectric point, below and above is there. At isoelectric point, their net charge will be 0, so there will be no migration. Okay, simple. Now what is here? The electrophoresis. What is the use of electrophoresis? The some other uses of electrophoresis. First one is what? First one is your protein separation. After that, it can be used by the DNA analysis, serum protein profiling, and all these conditions we can use the electrophoresis. Okay, so the right answer for this question will be your option number D. Simple. Next question. In IR spectra, the NH stretching absorption bands are observed in the region of. The first one is your 1600 to 1750 centimeter inverse. The second one is 27 to 3800 centimeter inverse. The third one is what 2150 to 2250 centimeter inverse. The last one is your 750 to 600 centimeter inverse. Okay, so if we talk about the NH stretching, before talking about the NH stretching, the first option is your 1600 to 1750. What comes in this region? 1600 to 1750. What comes in this region? In this region there is what? In this region there is carbonyl region. This region is what? This region is your carbonyl region. The peak of the carbonyl compounds comes in this region. If we talk about what? If we talk about this 2150 to 2250, this is what? This is for alkynes or nitriles. This is for alkynes. This is for what? This is for your alkynes. This is for your alkynes. Simple. This is for your alkynes. If you talk about 750 to 650, 750 to 600, this is what? This is your fingerprint region. This comes under what? This comes under your fingerprint region. Now this, the 27 to 3800, this comes under what? Here the NH stretching appears. And if you talk about the specific NH stretching, it will comes around like, it will comes under what? It will comes under 3300 to 3500. It will comes under 33 to 3500 centimeter inverse. Okay, 33 to 3500 centimeter inverse. Simple. Now, so the correct answer for this question will be what? Option number B, that is 2700 to 3800 will be the right answer for this question. Okay guys, simple. Next question, question number 76. What the question number 76 is saying? Which of the following is helpful in what? Which of the following is helpful in extending the life of a column in HPLC? If we have to extend the column life in HPLC, which of the following condition will be helpful? The first option is what? The first option is your sonication. What is the sonication? In sonication phenomena, we remove the gas blocks or dissolved air from the solvents. Next one is your degassing, third one is your guard column, and the last one is your gradient illusion. Okay, so the first sonication is what? Sonication is degassing and for the cleaning purposes. If you talk about the degassing, it is what? It removes the air bubbles, but it is non-main protection. And if you talk about the gradient illusion, it improves the separation. It has nothing to do with the extending the life of the HPLC column. So if we have to increase the life of an HPLC column, what we have to do? We have to add an extra guard column. We have to add an extra guard column. Before that, it prevents what? It prevents the it retain the impurities. It prevents the impurities to reach to the main HPLC column, and it also prevents other contaminants to reach to the main HPLC column. That's why it will help in improving what? It will help in extending the shelf life or life of your HPLC column. Simple. So the correct answer for question number 76 will be your option number C, that is the guard column is the right answer for this question. Next question. Choose the correct statement with regard to fluorometry. We have to choose the correct statement with regard to fluorometry. Okay, so here what are the options? The first option is mercury vapor lamp are not used in the fluorometry. Tungsten lamp is generally used as it gives a strong excitation around 450 nanometer. Next is what? Next is your hydrogen arc lamp are employed, and next one is your deuterium arc lamp are not used in fluorometry as they do not give intense sources. So what we have to do, which of the following is the correct? So if you talk about the first option, that is mercury vapor lamp are not, no, we use the mercury vapor lamp. Okay, so this is the wrong option. Tungsten lamp is generally used at it is, no, we not using the tungsten lamp in fluorometry. The tungsten lamp is mainly used in which region? They are mainly used in your visible region. So this is also wrong option. Next, if you talk about the option number C, hydrogen arc lamp are employed. Yes, we can use the hydrogen arc lamp. Next, deuterium arc lamp are not employed. No, this is also wrong option. We use it. Okay, what is the fluorometry? Fluorometry is based on what? Based on the emission of the light after excitation. Okay, and it is more sensitive than your UV spectroscopy. So the correct answer for this question will be your option number C is the right answer. Hydrogen arc lamp are employed. Okay. Next question, that is the degree of agreement between measured value and true value of an analyte. Okay, so degree of agreement, that is the measured value and true value. So if the closeness, it indicates that there is a closeness between the measured value and true value. If there is a closeness between measured value and true value, that phenomena comes under what? That phenomena comes under your what? Your accuracy. What is precision? Precision is what? If there is a closeness between the measured value. Precision is what? Precision is your consistency. For example, let me tell you with an example. Suppose the true value is your 100%, and now you have conducted two persons, A and B, conducted 3 times experiment. The person A got results like 80, 81, and what? 80, 81, and 82. And the second person, that is person B, got results what? Person B got results 98, 98. The person B got results like 98, 99, and if we again it is like 99 and 9, sometime 99.9. okay, so he got results like 98, 99, 99.9. so this value is what? This value is close to each other, as well as it is close to true value also, because your true value is 100. So this value comes under accurate value as well as precise value also. Now this value is not close to true value, but this value is close to each other. So if values are close to each other, then that comes under the precision. If values are close to true value, that will comes under your accuracy. okay, now specificity is your ability to measure analyte without any interference. For example, if you have to find the chloride in any compound, so if you are able to analyze that particular chloride without interference of other impurities or compound, then that is your specific test. Limit of detection is the lowest quantity, lowest amount of any substance that can be detected via your test is comes under the limit of detection. So the correct answer for this question will be your option number B, that is the accuracy is the right answer for this question. okay, next question. Aromatic hydrocarbons. What is the aromatic hydrocarbons? Show the following electronic transition. Aromatic hydrocarbons contains what? If any compound is aromatic, it means that they have conjugated pi bond system, that is conjugated double bond, that is pi electrons. So if there are conjugated double bond pi electron system are there, so what will happen? So they have a pi star transition. If we talk about the n pi star transition, for n pi star transition, they must have a lone pair and pi electron. For the aromatic, there is no lone pair. If we talk about the pi sigma, no, again sigma is not there. Pi star, yes. Sigma, if there is only single bonds and lone pair, so then they will go with the sigma. But here it is pi star transition, because in aromatic hydrocarbon there is what? There is conjugated double bond. It means that pi electrons are there. Simple. okay, and if we talk about the order of energy required, so the order of energy required between them is what? The first order, highest energy required is between, wait a minute, the highest energy is required between your sigma star, then after sigma star there is n sigma star, after n sigma star there is what? After n sigma star there is what? There is your pi star, sigma star, then n sigma star, then your pi star, and after pi star, at last the lowest energy comes under what? Comes under n pi star. N pi star, there is a lowest energy comes under your n pi star transition. Simple. And what is the examples of the aromatic compounds like benzene, naphthalene, anthracene? These are some examples of aromatic compounds. The correct answer for this question will be your option number C. What is the option number C? That is pi star transition. Simple. Next question. Question number next, that is 80,000, that is 1000 ppm sodium chloride is equivalent to, solution is equivalent to, ppm means what? ppm means your parts per million. So 1000 ppm, that is what? 1% is equal to, here 1000 ppm. 1000 ppm means that they are saying that 1% is equal to what? 1% is equal to 1000 ppm. 1% is equal to 1000 ppm. So if you talk about here like 10,000 ppm, ppm means parts per million in 1 million, so there will be like this, 1% is equal to 1 ppm. Now if you talk about here what? Here 1000 ppm, that is 1000 ppm. 1000 ppm will come under which category? 1000 ppm will be what? Will be 0.1% of this. 1000 ppm will what? 1000 ppm will be 0.1% of this. So the correct answer for this question will what? The correct answer for this question will be 0.1%. okay, now simple, just remember few conversion, that 1 ppm in dilute condition will simply comes under what? 1 ppm will be what? For dilute condition will be 1 mg per liter. 1 ppm will come under 1 mg per liter, and 1% weight by volume will be what? Will means that 1 gram in 100 ml. 1 gram in 100 ml. Simple. And what is the concentration of normal saline, the concentration of normal saline is what? 0.9% NaCl, weight by volume NaCl, that is the concentration of your normal saline. Simple. So the correct answer for this question will be your option number A, that is the 0.1%. Next question. The color change at the end point, in complexometric titration of what? Complexometric titration of magnesium with EDTA with iriochrome black tea as an indicator. When you use magnesium with EDTA and if we are using iriochrome black tea as an indicator, so when were discussing about these, then we have a separate tables of the indicators. On that I have told you each and every point. So what is the color change of there? So here the first option is your blue to yellow %, the second option is your green to red, the third option is violet to colorless, and the last option is what? Last option is red to blue. So the correct answer for this question, what happens at the end point generally? Here what we are using the EDTA and magnesium. So at the end point, EDTA and magnesium forms a complex, and now that free indicator will become blue. So initially there was red color, and at the end this magnesium and EDTA will form a complex, and that complex will, now that free indicator will turn into the blue. So the right answer for this question will be your option number D. The correct answer for this question will be your option number D. Simple. And this, now next question, the right answer will be your option number D. Okay. Next question. The indicator used in some redox titration, the indicator that we use in some redox titration is what? The first option is your methyl blue, the second option is your crystal violet, the third option is what? The third option is your methyl orange, and the fourth option is your phenolphthalein. So indicator that we use, if you talk about the crystal violet is used in what? Non-aqueous titration. Crystal violet is used in a non-aqueous titration. If you talk about methyl orange and phenolphthalein, it will comes under what? It will comes under the acid base titration. It will comes under the acid and base titration. And if you talk about the methyl blue is can be used in some of your redox titration. So the correct answer for this question will be your option number A, that is the methyl blue. Okay. Next question. Question number 83. Which one of the following is not a primary standard? In question they are asking which of the one of the following is not a primary standard. Okay, not a primary standard. First option is your silver nitrate, the second option is your sodium carbonate, the third option is your potassium permanganate, the last option is your sodium chloride. So they are asking the not a primary standard. So if you talk about your silver nitrate, it is what? It is a primary standard. If you talk about the sodium carbonate, it is also a type of primary standard, and sodium chloride is also a type of primary standard. But this your potassium permanganate, that is your KMnO4, it is not a primary standard. Why? Because first point, it contains the impurities, it also decomposes on storage, and it is not sufficiently stable. So it is not used as what? It is not used as a primary standard. What are the characteristics of the primary standard? First point is it should be high purity, it should be of highly stable, it should non-hygroscopic and high molecular weight. For example, is your the three options like silver nitrate, sodium carbonate, sodium chloride, and oxalic acids. Okay, so these are the examples of your what? Primary standard. Okay, so the correct answer for this question will be your option number C, that is potassium permanganate. It is not a primary standard. Simple. Next question. Question number 84. Choose the correct pair with regards to limit test. We have to choose the correct pair with regard to limit test. Iron hydrogen sulfide, chloride silver nitrate, sulfate barium sulfate, lead thioglycolic acid. Okay, so what we are using? If you talk about the iron, in iron what we use? We use the hydrogen sulfide in iron? No, we are not using the hydrogen sulfide in iron. In iron what we use? We use what? In iron we use thioglycolic acid. We use thioglycolic acid in iron, where we form the ferrous thioglycolate complex. Chloride, yes, we use the chloride with silver nitrate, that is AgNO3 plus chloride, that will result in formation of white precipitate, that is AgCl. Simple. Sulfates, barium sulfates, no, not barium sulfate. We use the barium chloride reagent. That barium chloride will again gets converted into the barium sulfate. Lead thioglycolic, no, we are not using the lead thioglycolic, we are using the dithiazole. Okay, so the correct answer for this question will be your option number B, that is the chloride and silver nitrate. Okay, so the B option, that is second option of this question, will be your right answer. Okay, simple. Next question. Question number 85. What the question number 85 is saying? Choose the incorrect statement. Choose the incorrect statement of the following. First option is your stannous fluoride is a dentrifies. It is saying that stannous fluoride is a dentrifies. Second option is your calamine contains zinc oxide and a small proportion of ferric oxide. Okay, C is not. This is the complete. Calamine contains a zinc oxide and a small proportion of ferric oxide. D, that is milk of magnesia, is used as an antacid. So if you talk about the first option, stannous fluoride is a dentrifies. No, we don't use the stannous fluoride as a dentrifies. What is stannous fluoride? Stannous fluoride is an anti-caries agent. It is what? It is a anti-caries agent. And what is dentrifies? Dentrifies means a tooth cleaning compound, that is comes under the dentrifies. But your stannous fluoride is an anti-caries agent here. And calamine contains the zinc oxide and a small proportion of ferric oxide. Yes, this is correct. And if you talk about the milk of magnesia is used as an anti-acid. Yes, milk of magnesia is used as an anti-acid. And what is the full formula of this milk of magnesia? That is MgOH whole twice. MgOH whole twice. This is the full form of formula of this milk of magnesia. This is very, very important. Okay, and stannous fluoride is not used as dentrifies. It used as an anti-caries agent, and it can be used to prevent the caries. Okay, so the correct answer for this question will be your option number A is the right answer. Okay, next question. In the limit test of arsenic, okay, limit test of arsenic, yellow stain is produced at the reaction of the following. So when we talk about the limit test of arsenic, the first thing that should come in your mind, that is the 𝙂𝙎𝙎𝙎 operators or 𝙂𝙎𝙎 method. We use the 𝙂𝙎𝙎𝙎 operators in the limit test of arsenic, and here they are saying that yellow stain is produced in the reaction of the following. So why the yellow stain is produced? First option, arsenious acid and mercury chloride. Second option is your arsenic trioxide and mercuric acetate. Third option is your arsine gas and mercuric acetate. The fourth option is your arsine gas and mercury chloride. So if you remember what we were using the mercury chloride paper, that is HgCl2 paper we are using. So mercuric acetate has nothing to do. Now that arsine gas is related, yes, that first thing, that arsine that is an impurity is present. Now arsine converted into arsenious acid, and then that arsenic gets converted into the arsenious acid, and thus arsenious acid gets converted into arsine gas, and that gas reacts with mercury chloride paper, and that will result in what? That will result in the your yellow stain on the paper, and the intensity of the yellow stain of your sample gets compared with the intensity of the yellow stain of standard. If the intensity of yellow stain of standard is higher, it means that your sample has lower limit of arsenic, then it will pass. But if it is lower, then your test will fail. So the correct answer for this question will be option number D. Now, the nascent hydrogen that is necessary for the production of this arsine gas is produced by what? It's produced by the zinc that is present in the bottom. Okay, and your arsine gas is highly toxic in the nature. So the correct answer for this question will be your option number D, that is arsine gas and mercuric chloride. Simple. Next question. Choose the correct statement with regarding to the SAR, that is structural activity relationship of sympathomimetic. The first option is saying that alpha and beta adrenergic activity is independent of 3 and 4 OH group of aromatic ring of beta phenyl ethylamine. Next is saying that amphetamine, which is lacking of OH groups on the ring and beta hydroxy group on the side chain, is devoid of direct sympathomimetic activity. RS enantiomers of noradrenaline are almost equally active, and if you talk about OH group on the beta carbon of side chain of phenylethylamine has greatly enhanced the central stimulant activity. So the correct answer for this question, what are they? Alpha and beta are independent. No, this is not independent. They are highly important, or they are very important for what? For the adrenergic activity of beta phenylethylamine. So this is the wrong answer. If you talk about the C option, that is R and S enantiomer are equally active. No, R enantiomers are generally more active than your S enantiomers. R enantiomers are generally more active than your S enantiomers. And if you talk about this OH group on the beta carbon of side chain greatly enhances the central stimulant. No, it is not enhancing, it is decreasing. Why it is decreasing? Because due to this OH group, your lipid solubility will decrease, and when the lipid solubility will decrease, so this will be also decreasing. So the correct answer for this question will be your option number B. Okay, so the right answer will be your option number B. Simple. Next question, 88. Phenytoin, that is diphenylhydantoin, an anticonvulsant it's prepared from. Okay, so what is the use in the preparation of phenytoin, that is diphenylhydantoin? So first option is your benzoin and thiourea. The second option is your benzyl and thiourea. The third option is your benzoin and hydrazine hydrate, and the fourth option is what? Fourth is your benzyl and urea. So for the preparation of this diphenylhydantoin, what is used? benzyl and urea is used. Here what happens, phenytoin synthesis in there is a condensation between this your benzyl and urea, and due to that condensation Heden-Twine ring gets formed. Okay, so in order to form the Heden-Twine ring, there is a condensation reaction between your benzyl and urea. Okay, now thiourea gives what? Thiourea gives the sulfur containing analogs, and if we talk about the hydrogen hydride, this is not used in the what? Phenytoin synthesis. So these are the wrong options. A, B, C are wrong. What is the phenytoin? Phenytoin, it is an anticonvulsant agent, and it is also act as a sodium channel blocker. And where it is used? It is used in partial seizure, and it is also used in your tonic clonic seizure. Okay, simple. So this what we use in phenytoin, we use the benzyl and urea. Okay, so the right answer will be your option number D, that is the benzyl and urea. Next question. The sulfonyl urea derivative. The sulfonyl urea derivative containing what? Containing the azepine ring, useful as hypoglycemic agent. So which of the following sulfonyl urea derivative that contain an azepine ring and water? So if you talk tolbutamide, glyburide, tolazamide and glimepiride. So if you talk about what? If you talk about the first option, that is your tolbutamide. So tolbutamide, it is first generation sulfonyl urea, but it don't contain the azepine ring. Simple. Same thing with the glyburide, it also don't contain your azepine ring. Same thing with the glimepiride. These three don't contain the azepine ring. The azepine ring system is present among what? It is present on tolazamide. So the right answer for this question will be tolazamide. Why? Because it contains of azepine ring. And what is the mechanism of action? Your sulfonyl urea. So sulfonyl urea stimulates the insulin release. Why? Because it closes the ATP sensitive potassium ion channel in pancreatic beta cells. And there are two types, first generation, second generation. In first generation there are three drugs. What are the three drugs? Tolbutamide, chlorpropamide, tolazamide. These are first generation. Tolbutamide, chlorpropamide, tolazamide. And second generation, that is 3G, that is glibenclamide, that is your glyburide, glipizide or glimepiride. Okay, glyburide, glipizide or glimepiride, these comes under the your second generation. Okay, so the correct answer for this question will be your option number C, that is what? That is your tolazamide. Okay, next question, question number 90. What the question number 90 is saying that O-tolidine is used as an what? O-tolidine is used as an starting material for the synthesis of. Okay, so O-tolidine is what? O-tolidine is your 2-methyl aniline. O-tolidine is what? O-tolidine is your 2-methyl aniline. Okay, 2-methyl aniline, and this 2-methyl aniline is used in the synthesis of what? It is used in the synthesis of your prilocaine. And prilocaine is what? Prilocaine is your amino amide local anesthetic. It is what? It is your amino amide local anesthetic. Okay, so the right answer for this question said O-tolidine is used as a starting material for prilocaine. Okay, so the correct answer will be your option number B, that is the prilocaine is the right answer. Very simple question. Okay, next question. What is the question number 91? Chemical name of haloperidol. What is the chemical name of your haloperidol? Chemical name of haloperidol is what? It consists of what? It consists of a chlorophenyl group. It consists of fluorobutyl phenone moiety. Okay, chlorophenyl group and fluorobutyl phenone moiety, as well as piperidol ring. Okay, remember piperidinol ring, not pipridol, piperidinol ring. So 4 chlorophenyl is there, piperidinol is there, and fluorobutylophenone is there. Okay, chlorophenyl is there, piperidol is there, but chlorobutylphenone no. Chlorophenyl is there, piperidinol is there, butylophenone no, fluorophenyl no. So the correct answer for this question will be your option number A. Okay, and what is haloperidol? Haloperidol is what? It is a D2 receptor blocker, and it is a type of typical antipsychotic agent. Okay, and the major adverse effect that is associated with the haloperidol, that is extrapyramidal symptom, that is your EPS. Okay, the correct answer for this question will be your option number A. Okay, next question. The anti-scorbutic activity of ascorbic acid. The anti-scorbutic activity of ascorbic acid is due to what? What is this ascorbic acid? Ascorbic acid is your vitamin C, simple vitamin C, and it is generally exists in mainly the most active form is what? It is, that is L form, that is a positive plus isomer of ascorbic acid. Okay, ascorbic acid. So the most activity is due to because of what? Because of this plus isomer. Okay, so L form. Okay, so the correct answer for this question will be your option number B, that is a positive isomer. Okay, next question. Diazepam is then oxazepam. Okay, we have to compare that between the diazepam and oxazepam. Okay, A option is more polar, more active, long acting, and less hypophilic. So if we talk about the diazepam is what? Diazepam is long acting than what? longer acting than oxazepam. Why? Because it has a longer half life. If we compare with the diazepam and oxazepam, diazepam has the longer half life, and oxazepam is what? Oxazepam is short or intermediate acting because it is a more polar due to your hydroxyl group, and diazepam is less polar. Okay, so the correct answer for this question will be your option number A. Okay, oh sorry, not option number A, that is option number C. Diazepam is long acting. Okay. Okay, so with this we have finished our pharmaceutical chemistry portion of your this previous year question paper. I hope you guys have understood the questions and answers very well. If you have any doubt, any question regarding these paper questions, if you have any query, feel free to mention in the comment box. I will respond your questions, and also prepare well, follow the contents that are provided on your the GDC English YouTube channel, so that you, as we have secured a very fast and very brilliant result in your Andhra Pradesh PGECET examination. Same thing we wanted for the Telangana PGECET examination also. So prepare well, and if you have any doubt, any query, feel free to mention that in the comment box. Okay. So with this, I'm ending the session now. Your pharmacognosy portion will start. Okay. So thank you everyone. Thank you for joining.
Hope you all doing well. Let's discuss or start with the pharmacognosy section. Okay. The first question is on our screen. Which of the following, they are asking about, which of the following is used in the plant tissue culture media that is mainly rich in cytokinin? Option A is yeast extract, option B is protein hydrolysate, option C is coconut water, and option D is the malt extract. Okay, so that particular question, the cytokinin as a C indicative of, it will mainly promotes the cell division, and also it will relate it to the initiation of coillus formation. Okay, so coconut water is going to be the option for that particular question, but the yeast extract, malt extract, and protein hydrolysate are also used in the plant tissue culture media. So mainly the yeast extract that is mainly rich in vitamin B, that is also known by a name of thiamine. Okay, the protein hydrolysate is mainly rich in certain amino acids and organic nitrogen content. Okay, and the malt extract will mainly contain what? It will mainly contain, as its name indicate, maltose in it. That is a kind of what? Carbohydrate. So C is the correct answer for that particular question. Moving towards our next question. That is 95th question. 95th question, that is asafoetida is. Asafoetida is also known by a name of devil's dung. Okay, so it is a kind of balsamic resin. Option B is oleoresin, option C is resin, or option D is oleogum resin. So there's a difference in between the two. That is, one is the oleogum resin and another is the gum resin. The oleogum resin will mainly contain three components in it. First is volatile oil, the second is gum, as the name indicate, and third is resin. Okay, but the gum resin will mainly contain two component in it. First is the gum and second is the resin. The example that will mainly contain the gum resin and asafoetida is an example of oleogum resin. So D option is going to be the correct. Other plants that have oleogum resins other than that of asafoetida are going to be myrrh plant is also having oleogum resin, and the guggul plant. Okay, so these all three plants having the oleogum resins in them. Coming towards our next question, which of the following is an indole alkaloid used for the treatment of glaucoma? Option A is brucine, option B is phytostigmine, option C is reserpine, and option D is atropine. So we all know the phytostigmine, which is being isolated from the plant, that is also known as what? The biological source of it is. So answer for that particular question, the pilocarpine, the physostigmine is mainly being used, or is the indole alkaloid that is being used for the treatment of glaucoma. Okay, so the physostigmine is isolated from the plant, that is also known by the name of calabarbine. Okay, belonging to the family Fabaceae. Okay, and what physostigmine actually is? It is mainly act as an reversible cholinesterase enzyme inhibitor. Reversible cholinesterase inhibitor. Okay, so these are some important points. And the native source of this calabarbine is from the Nigeria. Okay, so this is the all other important point that are related to that physostigmine that is being used in the treatment of glaucoma. Coming towards our next question, so option B is going to be the correct for that particular question. 97th question is the sulfur test. The sulfur test is positive for. Option A is cotton wool, option B is silk, option C is fibroin, and option D is going to be what? Wool. So out of these all options, the sulfur test is mainly done for that of the wool. So option D is going to be the correct option for it. So let's study or let's know about the procedure of it. So first we take wool, then boil that particular wool into a sodium hydroxide solution. Okay, after boiling, the wool will mainly contain the sulfur containing compounds in it or sulfur proteins in it. Okay, sulfur protein that are present in wool itself will get breakdown or releases the sulfide group out of them. They will mainly release the sulfite out of them. Okay, they are releasing the sulfite out of them. This released sulfite from that of the wool is then reacted with lead sulfate. Okay, and will give mainly what color? They are mainly show a color or give the positive sulfur test for that of the wool. Okay, so the sulfur protein as the wool is a kind of fiber, so the creatine is the main component of that fibers. Okay, so sulfur protein is mainly present in the creatine. These are the other related information that can also be important for you guys. Coming towards our next question, the cassia bark is found in the form of either they are single quilled or channeled piece, the double squill, the recurved pieces, the flat and recurved pieces. So the quill means what they are mainly indicate by the term quill. Okay, what the quill actually is. The first quill is mainly an indicator of roll. Okay, so how many roll form it is present. And the second word, that is channeled. Channeled is means that it is having a structure of half pipe like structure. Okay, half pipe like structure, or we can also say that it will having a structure of U-shaped structure. So yes, the cassia bark will mainly contain the single quilled, okay, and the channeled piece, the U shape or the half pipe with a single roll. So A is going to be the correct answer for that particular question. Coming towards our next question, which one of the following is levorotatory in nature or rotate the plane polarized light in what direction? In the left direction. Option A is lemon oil, option B is dill oil, option C is peppermint oil, or option D is fennel oil. So for that particular question, the answer is going to be the lemon oil is the oil that will mainly rotate the plane polarized light in the left direction. Okay, so there are other oils that are also rotate that plane polarized light in the left direction, that are going to be turpentine oil, that is also known as tarpentine oil. Okay, the second one, that is going to be the eucalyptus oil. The third one, that is the sandalwood oil. Okay, are the example of oil that will mainly rotate the plane polarized light in the left direction or are levorotatory in nature. Okay, so C is going to be the correct option of it. Coming towards our next question, the powdered licorice shows an orange yellow to a deep yellow color with 80% of H2SO4 or sulfuric acid due to the transformation of. Option A is glycyrigene and glycyrrhetinic acid. Option B is glycyrrhegenic acid and glycyrrhetinic acid. Or option C is liquidine and isoliquidine. Option D is liquidigenine and liquiditine. So that particular question, the option is going to be the yellow color of that liquor is when it combined with 80% of sulfuric acid is due to the presence of the main two component of that licorice. First is liquidine and the second one is going to be the isoliquidine. So C is going to be the correct answer for that particular question. Okay, and coming towards our next question, the umbelliferon. What is the umbelliferon? Okay, the umbelliferon is a derivative of option A is benzo beta pyron, option B is benzo alpha pyron, option C is benzo gamma pyron, and option D is 1,4 benzopyron. So we have to answer what the umbelliferon or umbelliferon is mainly derived from or derivative of. Okay, so they are asking about. So it is mainly a derivative of benzo alpha pyron. Okay, that is also this umbelliferon is a coumarin derivative. Okay, and having its family what? Its family is mainly Apiaceae. Okay, so benzo alpha, that can also be written as alpha pyron is going to be the correct answer for that particular question. Moving towards our next question, which of the following will contain the C glycoside? They are asking about C glycoside. Option A is betaramine, option B is brahmi, option C is 𝘿𝙬𝙎, and option D is what? Cochineal. Cochineal is a kind of insect. We already know about it. Okay. So the cochineal, that is a kind of insect, will mainly contain what? C type of glycoside. The other plant that having a C type of glycoside are aloe. Okay. The buckwheat can also belong to that particular category, and the senna is also belongs to that category. These are all other three plant that are also having the C type of glycosides. Coming towards our next question, the D option is correct for it. Okay. The red color insect that is known as cochineal is used to extract some of the pigment out of it. Okay. The question 103 is going to be the anti-rechetic activity of the cod liver oil is due to the presence of. So this activity is due to the to prevent rickets. Okay. This activity is due to prevent rickets. Okay. So rickets is mainly caused by due to the deficiency of what vitamin? Deficiency of vitamin D. Okay. Vitamin D will mainly cause rickets. Okay. So this question is mainly asking about option A is retinol, option B is chlocalciferol, option C is styrene, and option D is tocopherol. So the anti-rickety or ricket preventing activity, or in the rickets, the bones of children get weak. Okay. So what is going to be the answer for that particular question? The B, chlocalciferol. Chlocalciferol, due to the presence of chlocalciferol, the cod liver oil will mainly show that anti-rickety property in it. Okay. So B is going to be the answer for that particular question. Moving towards the next question, which of the following? They are asking about which of the following grow well in the drained, the loamy alkaline soil. So alkaline is mainly indicating the pH of the soil. The loamy is mainly indicating that in that soil there is presence of equal amount of what? First thing that is present in the soil is clay, silt, okay, silt, clay, and sand. So all three are present in equal amount. That is then indicated by the term loamy. And the drained means it not takes water. Okay, it not takes water in it. So what of the following will grow well in case of drained loamy and alkali oil? Option A is 𝘎𝑔𝑜𝑙, option B is cinchona, option C is tamaco, and option D is tea. Okay, so 𝘎𝑔𝑜𝑙, that is a kind of bulk forming laxative, that can also known as bulk forming laxative. Okay, it's going to be the answer for that particular question. Will mainly needs a drained loamy and alkaline soil for its growth. Okay, coming towards our next question, the esters or mixtures of esters of fatty acids with high molecular weight of monohydric alcohols are present in. Option A is spermaceti, that is going to be spermaceti wax, we can also say. Option B is cocoa butter, option C is almond oil, or option D is rice bran oil. So they are asking about the chemical composition of that particular oil or the particular wax they are asking about. Okay, so the spermaceti wax is mainly a combination of or a mixture of ester of fatty acid with that of the higher molecular weight of monohydric alcohol. So A is going to be the option or answer for that particular question. Okay, coming towards our next question, which of the following is not a part of plant exudate? Okay, option A is Indian tragacanth, option B is guar gum, option C is karaya gum, and option D is going to be Indian acacia. So the plant exudate are different from that of the seed exudate. So there are two things. The first one is the plant exudates, and there are second one, that is seed exudates. So the plant exudates are the thing that is oozed out of the bark of the plant. So they are mainly being oozed out from that of the bark of the plant. But the seed exudates are the thing that are being isolated from the endosperm of the seed. From the seed endosperm. Okay. So there is a difference in between the seed exudate and the plant exudate. So option A is Indian tragacanth, option B is guar gum, karaya gum, or Indian acacia. What of them is not a plant exudate? Okay. Yes. For that particular purpose, guar gum is not a kind of plant exudate. It is a kind of what? Seed exudate. It's mainly isolated from where? From where? The seed endosperm. Okay, seed exudate it is. The other example of seed exudate is the locust bean gum. Locust bean gum is also an example of seed exudate, or not an example of plant exudate. Moving towards our next question. Okay, the phylum bean, the phylum baleen is a catechol tannin, the condensed tannin, the hydrolyzable tannin, and the phloba tannin. So condensed tannin can also be known by the name of non-hydrolyzable tannins that cannot be hydrolyzed. Okay. Okay. And the phalambuline is a kind of or belonging to the category of hydrolyzable tannins that can easily be hydrolyzed. Okay, the example of certain non-hydrolyzable tannin, we have to remember some of the important plant that belongs to that category. One of them is catechu, that is non-hydrolyzable tannin or condensed tannin. The second one is the cinchona, and the third one is going to be the cocoa. Are the three plants that are belongs to the category of non-hydrolyzable tannin. So C is going to be the correct answer, that phalambuline is a kind of hydrolyzable tannin. Okay, coming towards our next question, which of the following crude drug shows a crystal sheath of each group of phloem fibers in its transfer section? Option A is cassia, option B is cascara, option C is cinchona, and option D is cinnamon. So they are mainly asking about the crystal sheath. Cluster sheath. So the cluster sheath can also be known by the name of cluster sheath. Okay, cluster sheath can also be a synonym of that crystal sheath. They are mainly an indicative. The crystal sheath mainly an indicative that there are a group of calcium oxalate crystal are present that are being surrounded by the either epidermal cell or either by the parenchymatous cell. Okay, so the crystal sheath or cluster sheath is mainly an indicative of group of calcium oxalate crystal. Okay, they are mainly an indicative of that. So, which part of the plant having its characteristic property of presence of cluster seed? Yes, this is the cascara plant. Cascara plant having its property to have that cluster seed. Okay, so B is going to be the correct option. Coming towards our next question, that is 𝘂𝙬𝙎𝑎 procumbens belongs to the family of Umbelliferae, Compositae, Ariaceae, and Iridiaceae. So, to which family the given plant will mainly belongs to? Okay, so this plant, you know that it is not a herb, it is a mainly small plant, and we can say that small plants are called what? Shrubs. Okay, and the another name of that plant is what? American. Is what? American wintergreen. American wintergreen. And the main chemical constituent that is being isolated from that plant is mainly what? Is mainly methyl salicylate. So these are all the important things that are related to that particular plant and can ask to you in question or different question or different exams again. So to which family that given American wintergreen will belongs to? So this American wintergreen is mainly belongs to the family Ariaceae. Okay. So the main characteristic of the plant that are belong to the Ariaceae family is they are small herbs. All the small herbs are mainly included in the family Ariaceae. Okay. So C is going to be the correct answer. Then we comes to the 𝘂𝙑𝘏. 𝘂𝙑𝘏 consists of the dry leaves and tender of the shoot of. Option A is Lousonia intermis. Option D is Antiprotozoal paniculata. Option C is Solanum cascioanum, and option D is Brassica nigra. So the 𝘂𝙑𝘏, that is an important question or multiple time asked in NIPER. The biological source of that of 𝘂𝙑𝘏 is Antiprotozoal paniculata. Okay, the another synonym that is given to the 𝘂𝙑𝘏 is king of bitters. It is also known as king of bitters. Okay, and the family to which the 𝘂𝙑𝘏 is belong to is Acanthaceae. Acanthaceae is the family. Okay, and the main chemical constituent that is present in that particular 𝘂𝙑𝘏 is mainly a diterpene lactone. Okay, this diterpene lactone is known by the name of, as its biological source name indicate, Antiprotozoal paniculata. So its name is Anticoagulant. Okay. So these are all the important information that is related to the 𝘂𝙗𝑚ic plant, and option B is going to be the correct for that particular question. Moving towards our next question, that is the protoalkaloid is mainly present in. So the protoalkaloid are the alkaloid we remember by trick MEC pro without ring. Okay, so they do not contain a nitrogen containing ring in it because it is indicating without ring. Pro is mainly an indicative of protoalkaloid. MEC is mainly an indicated. M is mainly the indicative of what? M is mainly an indicative of mescaline. The E is indicative of ephedrine. And C is mainly an indicative of what? Colchicine. Okay, so they are asking about what plant belong to that category. Option A is Ipecac, option B is Areca, option C is Gloriosa, and option D is going to be Dabosia. Okay, so Gloriosa, that is also, so that particularly we know that the protoalkaloid do not contain nitrogen containing ring, and the other example that belongs to that particular protoalkaloid class are the mescaline, ephedrine, colchicine, and Gloriosa is also one of them. So C is going to be the correct option for that particular question. Moving towards our next question, which of the following is a pair is an example of the chemical classification of the crude drug? Okay, we can also modify that question and we can say that or the pharmacological classification of the system. Option A is licorice Rauwolfia, option C is Senna and Vasaka, option C is Curchi and Cascara, and option D is Squill and Stopanthus. So from all of these classes, the only plant that having the same characteristic we have to discuss them about. So both of these plants, the squill and the Stopanthus, are belonging to the category of cardiac glycoside. Okay, cardiac glycoside. So D is going to be the correct answer. Let's discuss some other point or important point that are related to that of the squill and the Stopanthus plant. So the squill. Okay, for the squill is mainly obtained from the biological source Ardenia maritimia. Okay, the another thing, it belongs to the family Asparageraceae. And the red squill is also known as rodent poison or mouse poison or rat poison. Okay, the things that we have to discuss about the Stopanthus is it is mainly obtained from the two variety, that is Stopanthus combi and Stopanthus gratus. Okay, and belong to the family Apocynaceae. So these are all the other important points that are related to these both cardiac glycosides. So yes, the both plant belong to the cardiac glycosides class. That's why they having similarity or classified under the same class. So these are all the important points that are related to your pharmacognosy section. Thank you so much for giving your precious time. This is all about the question we have discussed from our pharmacognosy section. Thank you so much for giving your time.
Hello, dear students. Let's discuss the question from the microbiology syllabus. So the question number 113 tells is, identify the biological indicator which used in the checking the moist state sterilization. We have assigned special type of microorganism to identify the specific sterilization process. For moist state sterilization, which is basically Bacillus streptothermophilus, Bacillus subtilis, Pseudomonas dementia, या E. coli. For moist seed sterilization, your Bacillus streptothermophilus basically. Option A is correct answer. Okay, so Bacillus subtilis for use for the dry heat. Chalo, question number 140. Identify the sterility testing medium for the detecting anaerobic organism. Identify the sterility testing medium for the detection of anaerobic microorganism. Fluid thioglycolate medium, soybean casein digestion medium, nutrition broth, या fluid thioglycolate medium and soybean casein digest medium. For the anaerobic, please note it down. For anaerobic organism which specially grow in absence of oxygen, we use fluid thioglycolate medium. Which medium? Fluid thioglycolate. Okay. Chalo. Question number 115. Vitamin B12 is assayed by microbiologically. So first thing is, which species is used? The species is Lactobacillus leishmanii. This is the species. So this Lactobacillus leishmanii, when cultured, basically used for the microbiological assay of vitamin B12. And But which particular principle they follow? Their principle follow is torbidometry. Okay, so based upon this, turbidity will develop. That turbidity we will going to measure it. Option A is correct answer. Okay, chalo. Question number 116. An aqueous solution of heat-labile drug is to be sterilized. Identify the correct method by autoclaving, by filtration through 0.22 micrometer membrane filter, gaseous sterilization, या filter through 0.445 micrometer membrane filter. So a solution is heat level. First thing is heat level, it means heat sensitive. Heat sensitive, we cannot use autoclaving. So option A will not be the answer. Gaseous sterilization, no, because gaseous sterilization used for the plastic syringes and all. So gaseous sterilization will be not be the case. So it will be done by filtration. Okay, it will be done by filtration. Now in filtration, you have two options, 1.22 micrometer or 0.45 micrometer. So the correct answer is 0.22 micrometer. So filtration through 0.22 membrane filter. Okay, question number 117. Elimination of phenolic preservative added in a multi-dose viral drug sterility testing is. Elimination of phenolic preservative added in a multi-drug viral drug sterility testing is by dilution, by adding a chemical reagent, by penicillinase addition, by filtration. What does it mean? So if for suppose this is a viral drug preparation. To increase its shelf life, we added this phenolic preservative. Okay, so what is the function of this phenolic preservative? The function of this phenolic preservative, it will be prevent the growth of microorganism in this culture. So before going to sterility testing, we have to remove these preservatives. Otherwise, it will give a false negative result. If the microorganism there, this phenol will be reduce its number, and its level will not be going to detected by this testing method. So that's why what we have to do is we have to remove this phenol preservative from the product. Then only we go for testing. Then how you will remove by dilution? No. By adding a chemical reagent? No. Penicillin addition? No. But it will remove by filtration technique. We have to, by using this filtration technique, we have to remove it. And by removing this, we can go for sterility testing. Next question. Decimal reduction time. What is decimal reduction time? Time to reduce the total number of variable organisms by 90%. Time to reduce the total number of organisms by 10%. Time to reduce the total number of organisms by 0.1%, yeah, time to reduce the total number of organisms by 1%. Yes, decimal reduction time. So decimal reduction time is the time to reduce the total number of microorganisms by 90%. Then we call it decimal reduction time. If it reduced by 90%, we call it as a total decimal reduction time. Option A is correct answer. Question number 119. Thiolates are also known as iokinase, acetyl coenzyme acetyl transferase, HMG coenzyme synthetase, or thiophorase. What is thiolates? What is the alternative name for thiolates? What is the alternative name for thiolates? Iokinase, acetyl coenzyme acetyl transferase, HMG coenzyme synthetase, or thiophorase? The correct answer is acetyl coenzyme acetyl transferase. Option B is correct answer. Last question. Question number 120. Ketone bodies are produced by liver during period of low food intake or starvation from carbohydrate, from proteins, nucleic acid, or fatty acid. So so major site for ketone body synthesis is your liver. So liver will going to synthesize when you have a low food intake or you are on a prolonged starvation. Then by process of which process? This process called ketogenesis. By this ketogenesis process, they convert fatty acid into acetyl coenzyme A and acetyl coenzyme A into ketone body. Okay. So the starting is from the fatty acid. Okay, so option D is correct answer. So in this other part, we have discussed the important question for your upcoming exam. Thank you so much. Stay connected with GDC for more search informative contents. Thank you.